Thank you very much. Welcome everybody to the meeting of the Overview and Scrutiny Commission at Breckland Council on the 5th of September. We're now going to get started with today's meeting, and if we can move straight on into item 1. Which is the minutes of the 11th of July 2024. Are members happy to agree the minutes of the meeting held on the 11th July 24? Anybody against any of the minutes or any comments? Thank you. That's agreed. I'll sign the minute sheet. Thank you very much, Ruth. We now move on to item 2, apologies and substitutes. Can we have a list of apologies we received and any substitutes, please, Ruth?
Thank you, Chairman. We've received apologies from Councillor William Richmond. We have Councillor Stephen Askew as substitute. Apologies for Councillor Paul Plummer. We've got Councillor Hunter Clark as substitute. And apologies for Councillor Linda Turner, and we have Councillor Bowes as a substitute today. Thank you.
Thank you very much, Ruth. I've just got a short item under Chairman's announcements. Just to say, I'd like to welcome all members of the Commission and non-members as well, and obviously our speakers and presenters today. I'd like to thank the Council for appointing me as the new Chairman, and together with the Vice Chairman, Councillor William Nunn, as well as yourself, we'll do our very best to fulfil our role as the Overview and Scrutiny Commission. I've already advised members that we will continue with the room layout as established by the previous Chairman, with Commission members facing the presenters, so we can have a proper debate and not face each other's backs, which I think works much better. In addition to making better use of our time, both for Commission members and presenters and officers, I aim to ensure we receive any reports papers in good time in advance of the meeting, if not with the actual agenda. This should enable us, I hope, to think in advance about areas we want to ask about, what we might want to hear about again, and this should help all of us. I hope that also going forward we may have more task and finish groups which have worked successfully in the past. In addition, I'm personally pleased that we have the housing strategy here today, which is a detailed piece of work and which follows on from the housing allocations policy, which I think the Commission played its part in improving. I'm also urging members, which we have later on in the agenda, to consider in advance what should go on our work programme, other than the items which are obviously driven by the Breckland Council's forward plan. But not think about it just at this meeting, but also in between meetings. As usual, Commission members will be invited to speak first in turn and then members before turning again round, time permitting, to questions round the room. Depending on the length of some items, I may suggest questions to be asked in threes, which does cut down on repetitions and gives perhaps more depth to some of the questioning. Thank you, members. Now move on to item 4, urgent business. Is there any urgent business from members at all? I haven't been notified of any. Thank you very much. Item 5 is the declaration of interests, which is the duty to register, disclose, and not to participate for the entire consideration of the matter in respect of any matter in which a member has a disclosable pecuniary interest as set out in Chapter 7 of the Localism Act. Members are also required to withdraw from the meeting room as stated in the standing orders of this Council. Do members have any declarations of interest? I see no declarations of interest. Thank you. I note there are a number of non-members here today, so we welcome you to the meeting. We have an interesting and packed agenda. There's not a lot on it. There's a lot of detail to go through, and I'm sure members will have some questions about our very essential programmes and presentations. Now, the first one we have scheduled this afternoon is the portfolio executive member brief to be presented by Councillor Tristan Ashby. And later on, we've also got the Inspiring Communities under item 8. So perhaps if I can invite Councillor Ashby to commence any presentations. Thank you, Tristan.
Good afternoon, Chair. Good afternoon, members. Thank you very much for the opportunity to appear before you. And with your permission, I would like to provide agenda items 7 and 8 together, so to reduce any duplication, if that's okay with you.
Thank you, Councillor Ashby. It's most acceptable. Thank you. Please carry on.
Thank you, Chair. So thank you, Chairman, and to members of this Commission for giving me and officers the opportunity to update you on my portfolio, and more specifically on the progress in delivering the new Inspiring Communities programme. In regards to the Inspiring Communities programme, this will be an update to the presentation given to you following the call-in which happened at the end of February earlier this year. In that presentation, officers set out the new work plan, detailed the specific projects and outlined how it would further fund the next 4 years. It is pleasing that the Commission fully endorsed the programme with no recommendations made. I won't duplicate what is about to be shared with you, but did want to publicly thank the partners who are here with us this afternoon, who are all hugely busy, but our collective efforts are what makes Inspiring Communities such a life-changing intervention for so many of our most vulnerable residents. Their presence here today is a huge reflection of the strength of our partnerships across Breckland. In terms of my wider portfolio, the main focus has been on the delivery of enhanced leisure provision. The core PFI contract continues to provide first-class facilities for our residents across Dereham and Thetford, and Dereham has benefited through new funding with the provision of solar panels, reducing running costs, but also reducing its carbon footprint. In regards to Thetford, the delivery of the new 3G pitch continues to be progressed with ongoing commitment to work with Hockey England to find longer-term homes for clubs displaced. Officers are also continuing to work hard in the background on proposals for enhanced leisure provision for Swaffham, as well as the redevelopment of Attleborough Leisure Centre, which will also benefit from the additional provision of a 3G pitch. I'm now happy to answer any questions and then hand over to Josh for an update on the Inspiring Communities programme. Thank you.
Thank you very much, Tristan. It's now open to members to ask a question. Obviously, it's very pleasing to have, I think we're making some of the team online, but also other people here who are part of, Inspiring Communities. And perhaps if when you speak, perhaps it'd be helpful if you perhaps introduce yourselves or ask, obviously, Councillor Ashby to assist in that. So who'd like to start off with any questions, please? Sorry, members, I think if we could perhaps finish any more presentations, then we'll go back to the questions. I've jumped in too quickly. Thank you. Apologies.
Thank you.
Thank you, Chair. Before we talk about the new iteration of Inspiring Communities, I want to provide a bit of a backward look at the impact of the programme from when the programme began in 2020 up to the current time. So we've provided critical support and resources to more than 1,000 individuals, helping them rebuild their lives after experiencing domestic abuse. Our services have been a lifeline, offering safety, counselling and a pathway to recovery. We've successfully recruited and trained over 100 dedicated volunteers to serve as DAISY ambassadors. These ambassadors play a pivotal role in extending our reach, raising awareness and offering peer support within the community, amplifying our impact. Our initiatives help close to 2,000 families gain access to affordable food options, significantly easing the financial burden on low-income households. This effort contributes to better nutrition and overall well-being for those most in need. Through the Silver Social programme, we've brought together more than 400 residents to participate in arts and social activities designed to enhance mental health and foster community connections. This initiative highlights the therapeutic power of the arts in promoting mental well-being. Our collaborative efforts within the Breckland area are directly benefiting 250 residents, offering them tailored support and services. This partnership approach ensures that diverse community needs are met efficiently and effectively. We've trained 300 individuals to become mental health champions, equipping them with the knowledge and skills to provide essential peer support and mental health advice within their communities. These champions are now a vital resource in promoting mental health well-being and reducing stigma. We've conducted welfare support calls to more than 200 residents, providing them with guidance, assistance and a listening ear during times of need. These calls are a critical component of our broader support network, ensuring no one feels isolated or without help. Our team have supported over 90 young individuals and their families in managing mental health challenges while they awaited professional intervention. This service bridges the gap during critical waiting periods. We facilitated the opening of the REST facility in Thetford, which has since become a valuable resource for over 1,700 residents. This space provides a safe and supportive environment for those seeking mental health respite and community connection. Through our partnership with the Citizens Advice, we've successfully delivered over £700,000 worth of income gains to residents each year. This significant financial support has empowered individuals and families, improving their economic stability and quality of life. Our community health worker project reached 260 households and is ongoing, providing vital health interventions and support. Notably, this project directly contributed to preserving 3 lives, underscoring its critical importance in our community health efforts. Next slide, please, Ruth. So the new Inspiring Community programme aims to deliver the following over the next period: to address vulnerability and support the most disadvantaged in our communities, with a focus on improving the quality of life for the most vulnerable members of our communities by providing targeted care and support. This includes ensuring access to essential services and resources that promote well-being and stability, to collaborate to tackle health inequalities, by continuing to work closely with partners through our Health and Wellbeing Partnership and the Integrated Care System to address and reduce health disparities. This collaboration aims to ensure equitable access to healthcare and improve outcomes for all residents. We will improve the overall health and wellbeing of Breckland's residents by offering enhanced leisure facilities and a variety of wellbeing activities. These initiatives are designed to promote physical health, mental wellness and social connection. We'll take a proactive role in uniting partners and communities to maximise the use of shared resources. By leading these collaborative efforts, we aim to continue to create more efficient and impactful solutions for community needs. I'll now hand over to Josh, who's going to talk to you in a bit more detail about the progress with the new projects coming forward for Inspiring Communities.
Thank you. So as part of our commitment in March, we listed a few key projects that we said that we were going to deliver through the new programme. So one of the, and I'm lucky enough today to say that we've got some of our fantastic key partners here to talk about them in a bit more depth. But ultimately, we suggested that we were going to be delivering and working closely with Norfolk and Waveney Mind to strengthen our support network and deliver a comprehensive assistance to those in need through we classified it as an early help hub. It's now got a name. We said about the evolution and the improvement of our food support model. So we said we would enhance and adapt our food support offer, ensuring that it meets the growing and changing needs of our communities. We We talked about the development of pop-up hubs. So to increase accessibility, we would establish these pop-up hubs in rural villages, bringing essential services and resources directly to areas, and invest in our ASB resource. So we said we would allocate resource to address and manage antisocial behaviour more effectively, promoting safer and more cohesive communities. Extending of key contracts as well, so we committed to extending the contracts of essential service providers, ensuring that these crucial roles continue to serve our communities without any interruption. And also alluding back to one of our main objectives around continuing to support our partners being a main priority for us, ensuring that strong collaborations deliver impactful services and resources to Breckland residents. So this is just a picture of what we've been able to deliver so far through April of 2024 to August of 2024. So in the first round of the Inspiring Communities Match Fund, we provided just over £25,000 to support 6 Breckland-based community organisations in fostering local growth and community impact. We extended our vital support services, so we extended the contracts for our welfare support and community enabler officers, ensuring that these essential services continue to benefit Breckland residents. We empowered over 60 local community organisations through our community enablers to secure crucial funding and increase participation in community-driven initiatives, amplifying engagement and sustainability across Breckland. Our welfare officer delivered vital assistance to more than 120 residents, offering them the support they need during their challenging times. We provided nearly 200 residents with household support fund payments, and through our collaboration and early intervention payment programs, we were able to offer additional support. So by us administering that support via the household support, we were able to connect vulnerable residents with other funds which could support them more holistically. We connected residents through our social prescribing service, so there was over 250 residents were linked to valuable resources, including the creation, and we've also in that time created the joint position with Mid Norfolk Primary Care Network for a dedicated youth social prescriber. We've increased the support in Watton via our community health and wellbeing workers to reach over 275 households now, ensuring that more residents receive the care they need. We've trained over 20 Mindful Town community champions, cultivating a community of change, and empowering residents to take an active role in their communities to support people with their mental health. We've strengthened our multi-agency collaboration programme. So through our multi-agency early intervention initiative, we've provided support to over 20 residents, reinforcing the power of our collective action. We've invested in active Norfolk locality officer, so that by investing in that resource, we are going to be improving our physical activity offer in Breckland, promoting healthier lifestyles for our residents. And we've also been recognised for our excellence so far through being selected as a finalist of the Association for Public Services Excellence Award, highlighting our commitment to outstanding public services. So, however, none of this would have been possible if we worked in isolation. It's absolutely essential for us as Breckland Council to collaborate closely with the many incredible partners you see on the screen and also in person today. So together we can deliver the best possible service to our most vulnerable residents. We're fortunate enough to have some of these partners with us who will be sharing the inspiring work we're achieving together for the benefit of our communities. So with that, I'll now hand over to Amy from Citizen Advice Dis and Thetford to provide an update on the Shelf Pop-Up Pantry. Thank you.
Great. Yeah, so if you just, thank you very much for having me. Thank you for inviting me. It's really important that we're able to actually have this platform to talk about our services, because I think we, as a partner, we have felt like we've always had a really good relationship with Breckland Council, and then just having that opportunity to talk directly to you about what we do is great. But I won't spend any more time saying thank you. So if you can flick on, that would be great. So an update on the new service of the Shelf pop-up pantry. We've had a little bit of a delay due to the essential item of the van needing to get to us, and we wanted to make sure it's safe, in good condition, so we can provide the best service across rural Breckland for the pop-up rural community support for affordable food and health and wellbeing support as well. So that's happening next week on the 10th, and then which is really exciting. And then we have everything ready to go as soon as that's available. We just need to then obviously confirm the first location for North Lopham, and we're welcoming people, our partners, to come and have a look at that on that first location. So as soon as we have that date, which will be a Monday, because that's when we're planning for it to be, we'll invite partners to come along and join in on that. And then, as you can see, we're going through the resources and infrastructure, which is all basically ready to go. And as I said, you're welcome to come along and see that launch. So, next slide. So the idea of the Shelf pop-up pantry is obviously to extend the reach of the affordable food and resources in order to provide that accessibility to the rural communities. We know that isn't available across Breckland, and we know that Breckland is one of the largest and most rural communities, so it's really important that we provide that. We know that we can't do that alone, and we know that every affordable food hub in the Nourishing Norfolk network is different, and it is community-led, so it's based on the communities that you serve. So with the knowledge of the Nourishing Norfolk network and with the pantry, we are working in partnership to provide that. But we're very interested in getting more partners on board to provide that health and wellbeing support as well, and we're having conversations with more partners to do that. And that would cover anything from health inequalities to the mental health and wellbeing of the membership that we want to serve as well. So the first locations are North Lopham and Old Buckenham. We had put in the proposal other locations, but as we go through this process, and the strength of the Nourishing Norfolk network is that it is community-led, there will be iterations to where those locations are. We want the spread to be across Breckland. We don't want it just pocketed in certain locations. We want to make sure that we're providing that health and wellbeing support as well, so getting the partners on board for that, ensuring that our communities are content with that service, and also that our partners are on board at the same time. So it will absolutely start in September, and it will develop, and we'll be in communication as we are currently providing updates to do that. We also, the strength of the pop-ups and also the affordable food hubs is the volunteer base. And what we've seen is a really good response to being volunteers in many different ways, and that comes from working on the shop floor or providing the resource in terms of people growing for us, but also people supporting us in different ways with their business support and supply as well. And that takes time to build. So we're really pleased that Breckland has invested in a 2-year project, because that's how that project can build and get that volunteer network going, and that we see sustainability in it, from it growing over that time, and sustaining that and gaining that community engagement as well. So overall, we want the impact to be to enhance the access to essentials, support wellbeing, foster employment skills as well, getting people ready for work. It's definitely part of the UK Shared Prosperity Fund in terms of that. We run something very similar in DIS too, in how we recognise that we need to move people closer to work. So it's building into the local economy in terms of supporting and developing skills for employment. And yeah, engaging with the community and strengthening that network across Breckland. Yeah, no. So yeah, the plan is obviously, as I said, those first 2 locations and to go to 6 to 8 locations. And then those are currently looking like a spread across Breckland. We've definitely got Weeting pinpointed, but also near Nexham as well. But we would like to work with Breckland a little bit more on that data, because it does depend on the knowledge and the understanding of those areas, and also the current accessibility to the affordable food in those areas, and working with those suppliers and the retailers as well that are currently there, so that we come in showing that we're providing a very different service just to a shop. It's more than that. So we need to get people on side in those areas, so it takes a bit of time. We absolutely do want to collect data to show an impact of this service. So I've said, obviously, we as a Nourishing Norfolk network, we do collect data anyway on membership, how many people access the service, what's the saving for them in their basket each time they shop with us, how much we've saved overall, how much we've saved on food wastage. So we absolutely have to report that to Nourishing Norfolk anyway. And then we will be focusing on the geography of where people are coming from, the demographics, any barriers, with a focus on that energy and fuel poverty as well, because that's really important and still remains a consistent issue and challenge for a lot of our community and clients. And then we're looking at that also, who's accessing it in terms of the elderly population, those with health inequalities and long-term health issues. But we'll also be including families in that data too, because child poverty is a priority in terms of tackling that food poverty for our community as well. Is that okay? Yeah, so I think I mentioned it before. This the collaboration with Breckland has always been really, really positive. I believe that communication channel is always open with that, and has an impact on how we provide our services together and create shared value in terms of what we do. So part of that is we're looking at it in terms of always, for us, it's supporting our community. That's where we come from, how we can support our community to the best way in terms of the services we provide, and also together. For us, I see, for CADAT, we see a shared value in how you work, particularly in partnering. That's really important for us, investing in our community, but also how we invest in our people and support our people as well. I see that at Breckland Council too. And overall looking at the sustainability of our projects, and how they don't just look to put a sticking plaster on a problem, but hopefully are developing a service that we can see the impact of them, and then see how they can develop over time, or change, or have tweaks to extend them further over time as well. And then looking at our shared knowledge, that obviously we have lots of data and you have lots of data, and overlaying that across each other, and to find how we can support the communities that need it most. And again, looking at our relationship together and building on the future of that in terms of more longer term projects. And overall, if you're investing in partners that can provide that service anyway, not remaking the wheel, then you're getting an increase in value to the community in terms of what we can provide. And we're always looking at innovating. So in terms of innovating, that's absolutely one of our values, and we look at sort of how you can do something differently, or not necessarily differently, more efficiently. And I believe investing in partners absolutely achieves that. if that service already exists and we know we can do it together with your support and investment team. So thank you. Okay.
Thank you, Amy. So I'd just like to pass on to Sonia, and I think Robin is also on the call with us as well. So Sonia is the Interim Chief Executive at Norfolk and Waveney Mine, and she'll be discussing the link.
Thanks, Josh. And a massive apologies, I can't be with you there today in person, but hopefully I can get across how passionate I am about the link and how I truly believe that it's going to make a significant difference to a lot of people who need the services. So thank you, Chair, members and officers, and I'll begin. Maybe. Excellent. So yeah, I'm truly blown away, I think is the word to say, around Breckland District Council and the way our partnership has grown. I think we're fleet of foot to really make a difference. I think that's proven on a very small account in terms of the rest hub at Breck House. I think that's made a significant difference, and that's been because we've been working alongside other providers within that building. So the link is really going to be exciting, because I think that will massively expand other offerings that we can provide within Dereham. So I'll talk about the overview next, please. So I've worked in mental health for over 20 years. Prior to being as the interim chief exec, I was chief operating officer. Was very at the forefront of the design in terms of the rest hubs across all 5 counties, five areas. So the link and this opportunity is really exciting to be able to work alongside other VCSE partners, because what we do know is we're not the expert in everything. And what we do know is that there are always factors to why somebody becomes poorly. And it goes from anywhere between debt, physical health, housing issues, unemployment, physical disabilities or long-term illness, debt. It's never born from one single thing. It's several things that goes into somebody's pot that their stress bucket then overflows and they need the help that they need. So working in partnership and working together to provide pathways into various services under one roof will benefit people immensely. It means that people don't get pushed from pillar to post, and what frequently we see is people fall through the gaps because they're signposted somewhere and they don't get there, because actually it's took all of their effort to take that first initial step. So this is really exciting. I think the building's really exciting to be able to offer many services under one roof. Next slide, please. So in terms of a recent health report, what we do know within the Breckland area, that 2,500 people who live in the neighbourhood are considered to be in the most deprived part of the country. We know that it's affecting 4.6 of young people, which is 2% higher than the rest of Norfolk. We know there is an obese and overweight issue, and that is 4.8% higher than the rest of the country. And we do know that there is a huge area of MSK conditions, which is also 2% higher than the rest of Norfolk. We know that claiming out of work benefits within the Breckland area and claiming universal credit is an issue. And we know that 39% of people not within employment in the Breckland area is due to a long-term illness. So the progress today, the space has been furnished. The space is unrecognisable. I think everyone together working in partnership to pull together a real warm and welcoming space as opposed to a very cold, frightening space for somebody to walk into. It's completely transformed. We've committed and working with other partners who are going to join us, which include Breckland Housing Team, the Community Team, the Boost, Parkwood Leisure. The services we'll bring in, which I think are going to be heavily important to work alongside some of the other VCSE sector partners and other providers, will be our route service, and I'll talk about that shortly, our enhanced recovery work service, which I'll talk about shortly, and some peer support and the new talk and therapy service. I think for the people of the area, I think this is going to be really welcoming and will help lots and lots of people to not be in the position they are in today. So the services that we are looking to provide, so this is at this point, we hope that we'll expand that further as we open, but we will be providing employment support. That's our route service. That service provides CV writing, finding employment, retaining employment, working with their employer, into interview skills. They offer lots and lots of support to individuals, and it's a national, IPS is a national service. So I think it will be more beneficial for the local area, because at the moment we're offering support within local community cafes, etc. I think this will provide a service that's more confidential and less daunting for somebody to walk into. The mental health support that will be on offer will be through our PCNs, that's in our enhanced recovery worker service. That's from 14-year-olds and upwards, and that's through the GP. So similar to your social prescriber, but they offer some mental health support, and they can also signpost and refer into whether it's a mental health practitioner that's needed, or a GP appointment, or that person needs some support to access services. They will provide up to six appointments with that individual. And this has been running now for over a year. The service offers 45-minute appointments, whereas when you're at the GP surgery, you get 10 minutes. We've found that has transformed people, absolutely reducing GP appointment wait times, people sitting in GP waiting rooms, becoming stressed and having anxiety. They'll be able to come in a much more nicer environment, less daunting, to be able to be offered that support without having to go into the GP clinic. We are hoping to offer some specialist drop-in clinics, so we want to utilise our other services that we offer at Mind that we'll be able to offer within the building. But also we are liaising with domestic abuse drop-in services and support for victims of crime. So we'll have other providers coming in and offering drop-in clinics across the link. Also financial guidance and assistance with cost of living and energy crisis, working alongside DWP, CAB, Breckland Housing, massive. What we've found at Breck House is that often people are going to that support for DWP and housing needs, but often there is another need for mental health. So working in a strong VCSE and partnership way with other providers is key for people not to fall through the gaps. So there's some dates on the next slide. So these are the launch dates that we are wanting to adhere to. So we're really excited about being able to have a key partner launch, initial launch, a full public launch, and then providing some focus groups with key providers and service users who have accessed the support to really gather that rich co-production and service user feedback, and understand what other services we could provide, where else is there support that is needed, and what can we bring into the link. How we're going to success measure the service. We aim to place 40 people in permanent employment by October 2025. As I've said, Roots has been, our IPS service has been running for several years now and has had a massive impact positively on people being able to gain employment, but also people with severe mental illness who never believed they would ever work again. They have done an amazing job, so I'm really keen for them to be part of the link going forward. Obviously offering that back mental health support, so it's not at the forefront of the building, but offering a quiet private space where if somebody is going into crisis, we're hoping that we'll be able to prevent that from happening and be able to for people not to be, we believe that there will be reductions in terms of blue light and accessing those services that people tend to access when they feel there's no hope of anybody listening or having support from anybody else. And then obviously all the partners in place by the end of October 2024 after the public launch. We do have IAPTIS and we have our own clinical systems, but we'll work alongside other partners and other VCSE sectors to pull all of the knowledge that we have in terms of how are we measuring our success and how many people we've reached and what that impact has been on those individuals. Thank you for having me.
Thank you. Okay, I'd just like to pass on to Mark Hitchcock now. He's the Chief Executive of Citizens Advice Norfolk.
I am now. I've given you relatively small amounts of information here, but I thought I'd give you a bit of an exec summary on some of the questions that Josh gave me as homework. In terms of the inspiring communities, I would say they're peer officers in Josh's position presenting to councils across Norfolk on a fairly regular basis, saying much the same thing. Saying they are enabling partnership working, that they are helping their communities, strengthening health, etc., etc. I would say some of them are deluding themselves. I would say some of them are struggling to get out of silos and do things differently. And there are one or two that are doing things significantly differently. Breckland, for me, is the one council that I'd rather work with more than anybody else. So I would suggest that Josh was more accurate than most peers on that. And I think it demonstrates a way that we'd like to see everybody work together across the county. So thank you for inviting me and giving us the chance to say that, but also creating the culture whereby you're supporting this kind of approach. I don't mention much about our grant in the slide deck. I'm happy to provide more information to that. We give you quarterly reports. I would like to flag up that this approach in inspiring communities is good. My challenge to you is that it needs to go further and faster, and we all need to be part of that. The demand that we're seeing across Norfolk is still concerning. We're still outstripping cost of living issues at a national level. Breckland is running higher than the average nationally still, just. But generally debt is increasing and should be alarming to all of you because it'll affect the long-term futures of the children that we're talking about, and it will directly affect all the health indicators that you may be looking at. Citizens Advice work for advice is having a massive impact on mental and physical health. We don't tell you that very often. We don't get mentioned in the same breath, but everything connects up. So this is why inspiring communities with partners working together is key. I can tell you a little bit more about the trends if you're interested in the questions, but I would suggest that you put your shoulder behind this approach and you ask us to do even more as partners as well. In terms of the link, I will just mention that we've been brought in there. I thank Sonia for going into detail in it. I think it is one of the most significant projects in the county in that it is trying to break silos and work differently. And it's putting clients at the front of the list rather than bringing services together and then worrying about how clients are going to work. And the later slides go into a bit more detail about debt work. So if you don't mind, I'll talk about that in a bit more detail, but happy to go back to any of those comments on the front page. So if I could have the next slide, please, that'd be great. So one of the investments that the council makes is in debt advice. It is one of 2 councils that does it. The other one copied Breckland. Thank you very much. That member of staff sits in this building the majority of time, and that most of this data is off her back. So this is mostly the impact of one person. The numbers, I would suggest, are staggering. I won't bother reading them all out to you. But with people coming in with an average debt of 9,500 on their shoulders, that should concern you. That would concern me personally, and they have an awful lot less income than me. The nature of the debt as well on the bottom right should be concerning. We're seeing more and more temporary short-term measures of ways of raising debt increasing recently. And our debt team generally across the county is now starting to find it difficult to move clients to a positive balance, which is the first time they've ever said that. Debt is worsening. It is driving up demand in benefits queries past the point that we can support. And there are very few other agencies across Norfolk that will help you in that area or have the capacity to do so. So I have to tell you that when we tell you that we're struggling, nobody else is backing us up. And I would also just draw your attention to the age. So you are seeing many families, about 55% of our clients have got dependent children, and increasingly single adults coming in to see us. In terms of the people that come to our core service in Breckland, 20% are in their 30s. So those issues, those social determinants, are storing up health issues for the next generation or 2. It is no longer the older generation that is coming to see us generally. If you could flick to the next slide, please. Then there'll be a test on the numbers at the end. This is really trying to evidence the outcomes. And this took a bit of time, partly because this is a very small piece of work. It's one person in one town, mostly taking referrals, mostly from one team. That's a significant return on investment. It's very difficult to get people to pay for debt advice or to pay for benefits advice. Very, very difficult in this country. The return on investment in terms of client well-being, in terms of client health, in terms of economic spend locally can be seen there. Those numbers are drawn from a Treasury-backed model that Citizens Advice uses, and I would suggest that in many ways I've been conservative with my estimates. If you're interested in seeing more of those numbers, maybe trying to apply some of those figures to broader work across the inspiring community so we understand the impact, I'd be happy to do that. So, in short, thank you for the culture and the approach, and that's embodied by your officers throughout the organisation, by the way. And thank you for the support in terms of the core grant. Without it, we would be on our knees. And thank you for the debt investment because you're making a huge difference to your residents. Thank you.
Thank you, Mark. I'd like to just pass on now to Dr. Olga Siragiani, who is the Acting Associate Director of the Primary Care Network Development.
Apologies, Josh, it is unpronounceable, that name. But thank you for having us here today. And I will only be able to echo what Mark just said. It makes a massive difference for our local population to have a partner like Breckland Council. And I want to talk to you a little bit about the journey because it's not just one project, it's multiple projects and it's what's coming ahead. We're not always the traditional partner of a council, the NHS, but through the last 3 years, we have been in a journey to understand each other services, assets and challenges, explores new ways of working. It's not always easy. There's governance issue about sharing data. We have different priorities, and how then we're trying to figure out how we can create value to our population. But through these 3 years, we have become a trusted partner for each other, and I only can thank the officers and you for supporting this approach. because now we have started working also on the even bigger issues. I got the brief that I had only 5 minutes, so I will just list some of the projects, but I'm happy to add more detail to them. So we started with something simpler, which was actually to get hold of patients that were waiting for more than 52 weeks on the trauma and orthopedic list, and then give that to the council so they can contact the patients and see if they can support them. We know after COVID, people have been waiting for too long, and sometimes we don't think all the other support that they need around them. Equally, working with the Breckland PCN, that's the primary care network, that's the 3 practices that you have in the Breckland area. They were looking their data to identify patients that they had one long-term condition and mental health issues, and see again, offer that information data to the council and see how we can support them holistically. Because usually people don't have just health issues or social issues. These things come together, and usually we see them in isolation. To further work on that, after the success of social prescribing in primary care, through the Health and Wellbeing Partnership, we coordinated to offer support to secondary care and see how that works. And then we created some joint posts. So between the ICB, and you probably know that already, and Breckland Council, we have a joint post, which I think helps us a lot to progress this joint project, but also to understand each other and move quicker between the 2 organizations. This has proven an invaluable post, and there's a new paper because our clinical directors and practices found this post invaluable, and they want us to continue it now. So a paper is coming to the place, but for the continuation of the funding. You have probably heard about the community health and wellbeing workers in Wharton. It has been, excuse me, if you can move to the next slide. Yeah, sorry, I realized I was looking for mine. This is one of the projects that we are extremely proud of because it's constantly evolving and we're seeing more value. These are people that they start quite low-paid people as a band 2 in the NHS, employed by the district council, but they have been fully integrated in the local GP practice, and they knock the door every month of around 270 households, as Jules also mentioned later. The households are being selected by data and soft intelligence of the most deprived communities in that area. And what we have seen has been so valuable. These people have really complex social and health needs. Usually it might have been that we are seeing only the health needs and somebody else is only seeing their social needs, but that's not how problems come in life. These people knock the door and they can now offer holistic support. If they need an appointment to be booked in the practice, they will do it. If they need to refer somebody for benefits or they have issues with their housing, they can do it. There was a gentleman that they led them upstairs and he was getting ready to hang themselves. So I think we're making impact on the ground, but that's not the only benefit. It's not just the benefit on the population. The practice has seen that by deploying them, they have improved the relationship with their population. They have increased the rate of vaccination to children and adults for flu. And they have, because they have an Afghan community, they have been able to engage with them in a better way, to navigate them through the system, identify an outbreak of an infectious disease and treat it, and reduce the visits to the practice that weren't appropriate. Continuing from the conversation from Sonia and about the link, there are conversations already with the Mid-Norfolk Primary Care Network, our GP practices around Durham, on how they can also put people there to make it a really holistic centre. And another example of something that's now we're working on is the Durham Community Respiratory Clinic. So we have started having consultants in these clinics. But what we also do now is we're going to link that with the living conditions team so that if people have these respiratory issues because of their housing conditions, a referral can be made straight away and we can support them in a holistic way. So with this partnership, I think it allows us to target our support because we can share data, so we can, next slide, sorry. We can target our support because we can share data and skills and capacity. We can offer comprehensive support. It's not just health or just social needs. We can help them together as one. We can support the resilience of our services the same way that we have seen, for example, with the community health and wellbeing workers and the impact it had to the practice, but also utilize our assets instead of actually driving different initiatives when we actually try to serve the same population. But I just wanted to say here also, if we can go to the next slide, some of the comments of the people that have been served by the community health and wellbeing workers, if so you can see their own words. What moves me is the fact that they say how much it has helped their family. We're not thinking anymore about this is a health issue, a social issue, or we're only going to treat children, or we're only going to treat adults. Usually it's household problems that people have. And with this kind of integrated services, this is what we can offer, holistic support to the people who need the most. So a big thank you for being an excellent partner that makes a difference for us on how we can reduce health inequalities and improve health.
Thank you, Olga. Thank you, Olga. So I'd like to just pass on to Kate Biles, who is the Programme Director for DAISY Programme.
Thank you very much. Can we have the next slide, please? So with the DAISY programme, we support domestic abuse and sexual abuse survivors across Breckland. And that's important because we know that 1 in 3 women internationally and 1 in 6 men will experience domestic abuse at some point in their lives. And we estimate that something like 6,000 people in Breckland every year will experience domestic abuse. We know 1 in 4 children will live in a household where there's domestic abuse before they're 18. And also research that shows that in rural communities, domestic abuse lasts something like 25% longer than it does in urban communities. So it is a really important issue. It's an overriding issue that leads to the sort of things the other partners are talking about. We have 4 basic services in Breckland. So we are part of NIDAS, the Norfolk Integrated Domestic Abuse Service, working with Leeway. We actually provide services in Breckland, Kingsley and West Norfolk and North Norfolk. And that service works with people who are in crisis, who really need support to make themselves and their families safe. And then we have the DAISY programme, Domestic Abuse Recovery Service. Now, that's quite unusual. Most domestic abuse stops when the crisis stops, but unfortunately the impact of domestic abuse doesn't stop then. And the impact of domestic abuse will affect mental health, it will cause debt, it will cause all sorts of ill health. Now, our DAISY programme, which is our core service really, which is where we started, aims to empower people to rebuild their lives and move on from domestic abuse. We also have a fantastic family service that works with children and young people. And they're often the forgotten victims of domestic abuse. And for many of those children and young people and their parents, unless they get the support they need, that's when their evidence shows they go on to become engaged in criminal activity or all sorts of other things. And finally, we have a sexual violence and abuse service, our own project, that works with anybody over 16 who has experienced sexual violence or abuse at any time in their lives. Next slide, please. So where does Inspiring Communities fit into this? The funding we get through Breckland Inspiring Communities is really for 3 aims, and that's to provide easier and more accessible access to our support. And we do that through our team of DAISY ambassadors. They're volunteers who are all people who have experienced domestic abuse. They're experts by experience. They're fantastic positive role models for people in the community. They attend community events, they talk to community groups, they talk to very small scale groups quite often, but it's that seed planting. They talk to people at school gates about domestic abuse, and quite often people will come up to them and ask them for their advice and support. The second aim of the Inspiring Communities funding is to actually help our partnership working, make the support we provide, take it out. We're based in Watton, we have a community hub in Watton, but we provide sessions across Durham, Thetford, Swaffham, Attleborough, and also our Daisy ambassadors will provide peer support in local rural communities. So if somebody has to move because of domestic abuse and they're socially isolated, they will help them to go along with them sometimes. People lack self-confidence when they've been through domestic abuse, so they go along with them perhaps to the local play group or something like that. And we have an early help and community outreach officer who attends early help collaboration meetings in order to work with partners. And then thirdly, what we want to do across Breckland is just increase understanding and awareness of domestic abuse. And we do that mainly through training and awareness. So we deliver a lot of training awareness to Breckland Council staff, particularly the housing team and the community staff. And then we deliver an awful lot of training awareness as well to organisations and groups and practitioners, statutory partners, CAB partners, all sorts of partners across Breckland, because we want to make communities more aware and understand about domestic abuse. Next slide, please. No, the one before. There should be another one. Is there not? No, okay. So we have an early help and community officer, Christina, who is directly funded by the partnership funding. We estimate over the 3 years since the funding started, she personally has had about 2,000 contacts with Breckland residents. She's done things like, we've got partnership with Durham Football Club, so she goes along there and talks to the young people at the football club about healthy relationships. She has a show the red card type presentation that helps them to understand about domestic abuse and things like that. We have 1,500 followers on our Facebook account. As I say, we have drop-ins across Breckland, including one at the Rest Cafe in Thetford. She has delivered something like, provided advice and guidance to 153 community organisations or practitioners. So it's all about spreading that word, making people more aware. What that means for the council is we are able to provide bespoke training. So if the council have housing staff starting, they contact me and say, can you deliver a session on whatever? And we will deliver it. We have a firm commitment to the early help collaboration. That means we can support partners before cases get to high levels. We provide that awareness raising, we participate in community events and support for the county community initiatives. Additionally, we estimate that Breckland Council was one of the first organisations that started funding us. We started as quite a small organisation in 2015, and I think it was Steve actually that started that process off. Now, through that initial funding that you have provided to us, we now have been able to access an additional investment in our programme, in our charity, of £678,000. That has been tremendous for us. We've just grown from 3 paid staff to 23 paid staff in the course of 3 or 4 years. So that's really important for us. But additionally, and more important, next slide, please. It's what people in Breckland receive, and they get our support to help them rebuild their lives. There are very few support services across Norfolk that actually help people who have experienced domestic abuse to move on, to recover once the crisis is over. And we are the only district, Breckland is the only district that has support services based in one organisation that can support people affected by domestic abuse, whether they're at high risk of harm or needing to move on because their risk has reduced. Everywhere else in Norfolk, people have to move from one organisation to another and repeat their story. We provide sexual abuse support as well as part of that. And we provide a range of programmes, activities, and actually fun, because one of the best things we find for recovery is people laughing together. So if you look at our drumming workshops or something like that, and you have adults and children there, and they'll be banging away and they'll be laughing, and it's just fantastic to see people who come into us like this, just coming out shining, so different. And our service is, the vast majority of our workers, our staff, all of our volunteers actually live in Breckland. So it's a service provided by and for Breckland residents. It's based in local Breckland communities. And really important to us, we're really integrated with local providers. And that's why Inspiring Communities is so important to us, because the organisations we work with, you know, we can't do everything about somebody's debt or mental health. Actually means we have got people we can draw on to work with us to help our clients. So overall, next slide, please. What that means is our clients, 85% of our clients report improved mental well-being. 89% of our clients actually report feeling safer. 82 report better community connection, and that's really important in Breckland as well, because Breckland actually has much higher levels of social isolation than any other district in Norfolk. And through that, we help people to avoid being repeat victims and therefore relying more on statutory services. And overall, what we want to have is communities across Breckland who understand domestic abuse, can help people to access support earlier and stop it escalating. So that's us really. I also wanted to say a personal thing to you as members. If you have residents that come in to see you or talk to you about domestic abuse, we are always happy to take calls from you to provide advice or information about that. I have actually got some leaflets here that I'll leave there in case you want to pick one up, just so you've got some numbers to ring us, and also details of our drop-in sessions across Breckland. Thank you.
Thank you so much, Kate, for delivering that. That's really, really impactful and showcasing the work you deliver. Lastly, I'd like to pass on to Sonia Humphreys as well. So if you would like to go to, who is the Superintendent of Norfolk Police.
Thank you. So firstly, I'm going to throw Josh under the bus because it was can you come along please to the panel? Yes, of course I can. And then next it was, and present. Hang on a minute, that wasn't in the original request. And then the third challenge was me just talking for 5 minutes, which anybody who knows me, 5 minutes can be a bit of a struggle. So I will do my best. Not because it'll be too brief, but more the other way. But I'll try and keep to the brief. So with regards to the constabulary, when it gets to us, you know that it's gone wrong. Because by the time it gets to us, all of these other things have accumulated, and we are the final piece in the jigsaw puzzle. We don't necessarily make people's lives better either with the interventions that we make. We have very limited toolkit available for us, and that generally is through the criminal justice process. But what we're now starting to see and what we're trying to do is look at not just intelligence-led policing, but that more evidence-led policing as well, where we can actually get ahead of ourselves with regards to the problems, and that's where this all comes in. So if we recognise that we have these problems, and we've learnt time and time again that an adverse childhood experience will result in somebody coming into the criminal justice system, we know that if we have all these health issues, they're likely to come into us. So if we start to see those families coming in, we need to get ahead of ourselves, look at those young people, look at those early indicators for some of the behaviours that we're seeing, and then start to link in closely. So a few years back, the operational partnership team, now there's a clue in the message there, partnership team, sat separately in different parts of the district. What we're now starting to see is that police officers coming back into the building here and working. Some of that was born out of COVID and the fact that everybody sort of dissipated back to home working. But we know that we're better if we work together, and that information sharing is much faster, much more effective if we're all in the same building. So the direction is back into the building, please. And now let's start to work together better. Information sharing around and galvanising this part of the county as well. So having that horizon scan. We know that if we see other areas targeting issues such as vehicle ASB, so you see those car meets that are taking place. If other parts of the county are doing one thing, let's make sure that Breckland doesn't leave themselves exposed. So it's us bringing that information and the intelligence back into the teams to say, look, this is what the rest of the county are doing. If we don't keep pace with this, that could leave us exposed as well. So it's that horizon scan again for, look, this is what's happening. Let's make sure we're in the right place. Now, interestingly, last weekend, there was due to be a car meet in Breckland, and the social media posts that were going out were, don't bother, they're looking at a PSPO, so the problem-solving approach, where there'll be convictions off the back of some of that antisocial behaviour, was then discouraging people from turning up, and they were putting that out themselves around the fact that Breckland looks like it might not be a good place to be going. So if we come to you and say, look, please, can we consult on this? The reason we're doing it is based on evidence, it's based on intelligence, and it's making sure we don't leave ourselves vulnerable. So there's some good pieces of work that's happening there. The last 12 months has seen us working closely together around closure orders, not just from the residential side of things. I'm not a massive fan of making people homeless, because that just leads everything back into this side of things, and it just generates a bigger problem. Let's get ahead of ourselves. There's been 2 closures on a residential side of things over the last 12 months, but more importantly, use of legislation and powers around closure orders for our vapes. So the shops that are selling the illegal vapes. So you've got your tax evasion, et cetera, that's going on there. And some of those people who are engaged in that are engaged in organised crime elsewhere in the county, elsewhere in the country. So if we can get ahead of ourselves on those and work together, we're now starting to see those places being identified and closed down, because they're linked to much more than just having vapes in there. So we've had 3 of those now across the Breckland area shut down, which is not an easy task and no mean feat. Some of the other work to mention as well, that many of you, I know, have a direct line into beat managers, etc. You've raised concerns around some of the rise in ASB that we've seen. We have seen that within some of the Dereham locations. We have seen some of that within little pockets of Thetford. Over the summer period, we intensified some of our responses to that, making sure the intelligence and information flow was there. We ended up with 5 arrests over that summer period, which has resulted in unfortunately, children being involved in this. And that's my plea back to yourselves, is regards to, we don't want to start criminalising children in this county. That's not going to help them with regards to their futures. We need to start to think about, what does that look like from a diversionary aspect, and where can we then base ourselves to make sure that we see where that's going and provide things for these kids in this area to make sure that they are going into other activities. We've got some cracking leisure facilities here, but if they don't feel like they belong in those leisure facilities, they're not going to step inside those leisure facilities. So it's more about those street-based activities. How do we get out there? How do we do that work? So that's the direction of travel for us over the next 12 months, is to try and look at how we can catch those children who are out there, but divert them rather than criminalise them. That's not where we want them to be. The other issues as well, we've got the serious violence duty. Some of you may have even been engaged in some of the consultation work that went on with regards to that. There are some draft documents that are being produced by the Norfolk Office of Data Analytics, so NODA have done this. They've focused on North Lynn, Dereham Central, Toffwood. There's one done for parts of Norwich and one also for Great Yarmouth. Once they do come out, the Dereham Central and Toffwood one makes for a good read. But what you will notice in there's a couple of hotspot locations within that area that are interesting. One of them being Quebec Street. Now that's licensed premises. So that's, again, is going to involve us working together from the licensing aspect, because that is an area where we've got public order arising from things such as the public houses that are in that area. So if we have smart licensing conditions, if we're making sure that the landlords are held to account for some of the issues that are going on, better security within those venues, because it isn't just on the police to be making sure that those premises are run appropriately. Our resources are limited as well, but it's how we do it together. And one of the other areas is one of the children's homes within Dereham that is generating time and time again some of the returns from there. So that's not to say that children's home shouldn't be there, because it does fantastic work with some very difficult children who have had some very difficult experiences in their lives. But when you see it, that's where some of that is coming from, and that's why the Dereham Central then sits where it does within the county for that. Now, some of those deprivation index pieces that we've been talking about does feature, but generally we sit mid-league across the county in Breckland. We aren't the extremes, which is pleasing to see, but there are areas that we can work, and we will continue to work together and work with our partners to make sure we address any of those issues that come up. I think I've probably done more than 5 minutes, but okay, thank you.
Thank you very much. Can I thank you, Tristan, and the presenters who came along today. It's been sort of quite a packed session. I've learned quite a few things here. We've gone over sort of 6 areas. I know that earlier in the year we looked at the whole Inspiring Communities programme, 1.2 million investment by Breckland, and we commended that and discussed that at Cabinet. And I'm sure that members will probably want to delve further into some of these different areas. We've got 6 areas, some of which overlap and some of which interlink, and show the breadth of work that's being done, and also some of the opportunities, but also I think the challenges. I think quite a lot of us as councillors know about those challenges. I am conscious of time with other presenters, and what I might suggest is that we may have questions just entirely for, say, the police or the CAB, etc. And I think if there are obviously any areas we want also to follow up after we've finished any rounds of questioning, we can also feed those back through, the Commission, through to Tristan and presenters, and also think about whether there are areas that we want more depth in. So this is now putting more flesh on what we heard from, Inspiring Communities team earlier in the year. So thank you for that. So I'm now going to ask members if they have got questions, and if they can make them brief. And just to alert you, when we finish the questions on the Inspiring Communities, I will be proposing a very short comfort break before we go on to the next 2 presentations, if acceptable members, if members are happy after we've had this session. Thank you. I think, Peter, you were first.
Thank you, Mr. Chairman, and a great thank you to all our speakers today. And I'd just like to start with, I've got 2 questions, but I'd just like to start with the Inspiring Communities programme. Has evolved over the years, and taking more agencies under their umbrella has really helped ward members to work with the members of the public, and especially the Young Children's Mental Health Programme, the Cup of Tea, which I championed through the Breckland Youth Advisory Board. That came to fruition, and figures are telling us now that the programme Cup of Tea run for people waiting for mental health are now not requiring that mental health, because the programmes are working what they're doing. So that's, I'll have to thank you again for grant funding for that Cup of Tea. I've got one question for Sonia. Sonia, I believe a few years ago when I visited Wyndham HQ as the chair of Norfolk Association of Town and Parish Councils, there was a dedicated mental health officer working with night staff, helping and supporting beat officers and patrol officers if they came across possible indicated with people being arrested or picked up or spoken to with mental health issues, and they had that support. Is that still there?
No, unfortunately not. So although they were, they there were 6 posts, I believe, that then came into our control room. So they were meant to be starting out to do outreach, and then the demand was so high with regards to supporting the control room with calls that were coming in. They then ended up more predominantly based within the control room, sort of working dynamically. What they have done though is they've reviewed that over the last, I believe, 12 months, and those staff have been then recalled back into the Mental Health Trust to go back into those posts. So they're no longer with us, but we have that access via phone call straight into them. So the street surgery type work is not there with regards to that. You'd be well aware of the fact that we are in a position where Right Care, Right Person has been rolled out over the last few months, so that we make sure that the right service is being accessed by people, rather than it getting to the tail end of the problem and it coming into our service, where quite rightly there are other interventions that can take place before it comes to us.
I probably should have answered my own question really, because now you've got the custody suites, that enables you then to do that process with bringing a mental health officer in to help with the police. Whereas in my day, we only had the local police cell locking people up, and they've probably got mental health issues we didn't understand at that time. So that is evolved, and I really appreciate how that's evolved. Is Sonia still there? Sonia Chilvers, a question for you, Sonia. Yeah. The link is fantastic. I've never been a supporter of organisations working in solo, because they've never been successful, or working in silo, they've never been successful, or sustainable, I should say, not successful. But bringing this together in the link is really good, because like you said, at the front door, you can identify the issues which are probably could be resolved without them going to a mental health issue. And my question is really, what evaluations and methods will be used to access the link's impact and effectiveness?
So I think working alongside, we've got some key areas that we'll be focusing on in terms of looking at success measures. But what we want to be able to do is track footfall into the link, track service that are presented, track appointments, DNA rates and calculate them. And each service provider will share their current impact and result measurement to a central place, so that we'll be able to identify the whole service from everyone within that building, in terms of how much impact that's had on the local community. And for me, it's massively around prevention. So we're hoping to reach people before it gets to any crisis point, and try and, that's why the key members that we're working alongside, and you've got them in the room today, I think are going to be key to be able to pull together. I know Mark's team are amazing at capturing some of that information. So hopefully all our heads together will be able to capture some really key data that will evidence the impact that this has.
Yes, thank you. Thank you. And I'd just like to say, Chairman, while I've got the mic, I've worked with the DAISY programme as well, and CAB, and as an individual, not a councillor, I've worked with some of my Conservative councillor colleagues to remember the children, what you mentioned, that sometimes are forgotten in a domestic situation. So we, as you know, probably help with the Christmas presents and Easter eggs and things like that. So we really appreciate what you have been doing, and that is a key part of helping the police as well. Another thing I didn't have in mind.
Thank you, Peter. I think Councillor Land is next.
Thank you, Chair. I've got a number of questions. I don't know how you want to do this. Amy, you're first, I'm afraid. I'd like to ask you about the independent tenants and leaseholders advisor that's just is in the process of being set up for the Abbey Estate in Thetford. There's a lot of complaints from residents who are confused and angered that you appear to be working for Flagship. Flagship say they fund you, so I assume you get some sort of monetary advantage there. They don't understand why members of this can only be taken from the first phase of the redevelopment, but would be responsible for all flagship homes. So they struggle with that. They're also upset that the website was so difficult to access. They've only just found it, and they've only a few days to make their applications. So I'm wondering if you could reassure residents over that, please.
Absolutely want to reassure residents. Thank you for your question. I don't know. I can answer it now. I don't know if it's relevant to kind of what I've come here to talk about, but I'm more than happy to.
Should we have I'll pass you over the number. Should we have a chat about that another time?
Just aware that I have all the details for you, but I'm just aware it might kind of, just because some of the information you provided back to me is not quite representative of what is the process of what's happening. But I understand there's a short timeline on it.
So I think the point is there is a disconnect between the two that we need to bridge. I'd be very happy. I'm actually chair of the Abbey Action Group as well, so I'll be very happy to make contact with you and see if we can pull something together on that.
Great idea. So if we can get in contact and have a kind of an extra discussion, that'd be brilliant. Thank you.
Question 2. I was really pleased to hear Mark talking about how the citizens' advice work along with Breckland District Council. I think it is a model to follow. Thetford Town Council are trying to do the similar thing. Where are we with that?
This is like a pick and mix, isn't it? We are so grateful for kind of this cross-cutting work that we do with sort of very locally down to Thetford level and also parish level now with the new pop-up service too, which is exactly where we want to be. So Thetford's, for me, is going really well. So we're just about to kind of come to some form of agreement on that very local support across the wards in Thetford. But what we want to do, which is kind of our overall future plan, is to actually bring, because as soon as you create a boundary, that's really difficult for residents, and we're really aware kind of if you're not supporting that whole community, it shifts the problem around. So what we want to do is create some kind of support where we join up what will be a specific welfare and benefits advisor across a larger area, and we're looking at committing the funding to that and providing more match funding to that. So it becomes, as opposed to a 3-day service, a 5-day service. Because we're going to get people coming in who aren't from those wards, and it's awful just to turn them away.
Councillor Landry, microphone.
I think we do want more than just benefits and welfare. It's a wider service we're after.
Absolutely.
Thank you. Well, what I was going to suggest, some councillors may have some detailed, shall we say, ward type specific as opposed to general questions which may relate to their ward or not. And I think what we will want to do, I'm sure quite a lot of councils want to follow up some of the things in detail which can go through the commission back to Tristan and present some more detail. If I can perhaps come back to you, Terry, after, see who else has got a question, because we're now 3:05. I've got Stephen Askew next, and then Sam Taylor, and then if we can then come back, go to David Wickerson, Terry and Robert. We do have another presentation to come, just to remind members. Thank you.
Thank you, Chairman. I'll keep it brief. This is to Amy. During your presentation, you touched on data collection to monitor the progress of the pop-up pantries. So how will you use that information to make your decisions and on locations moving in the future? And secondly, you mentioned working with local communities, setting up local food hubs. So how do you envisage getting that started? You know, what sort of method? That's what I was get to. Thank you.
So just to wrap up, so you're looking at what data we're going to collect and how that will look at that sustainability of the project and how it impacts. And then second question, just to clarify.
Well, you mentioned on your slide, it said about, sorry, thank you. On your slide, it said that you were hoping to work with the local communities to set up food hubs. Maybe I got that wrong. I thought that was what it said, and I just wondered how you envisage going about that with the local communities. Thank you.
Thank you. So on the first question, our KPIs, our data and our monitoring, we'll look at it in 3 ways. So we break it down into the KPIs for the Nourishing Norfolk Network, which is the membership and the income back in people's pockets and the food wastage and that kind of cyclical economy. Then we'll look at it from a volunteer point of view and our volunteer base and collect data on that and the moving close to employment. And so how many volunteers are on the roll and what skills they're gaining. Then we will look at it in terms of those specific measurements on the focus areas, so the over 50, the families, the health inequalities, and the fuel and energy poverty. Because they're key things. We're very interested in the rural communities because there hasn't been, or a service quite like this, there has been a mobile food pop-up, but not like this, with the combination of the partners working together with different expertise and knowledge in that. We're really interested in collecting the data on those specific areas to then overall look at that impact and what services people want to access, the different types of services like from our partners basically. And then we'll be able to use that to do an overall gathering to see where we're getting those pinch points or where the service isn't able to provide that support, because that's really important. It's not about saying this is going to fix a problem. It's about actually highlighting where further support is needed and how people can access that as well. And we're focusing on those areas because in more urban areas, people are finding easier to reach and access that type of affordable food and resources and services, whereas in the rural areas, they're not. On the second bit, it's one and in the same. So we are, and which is why we're rolling it out as opposed to going, here's 8 locations and we've decided them. It's community-led in the fact that we create connections and networks within the communities we would like to support. That is data-led, so we have identified 6 or 8 locations where, for example, we saw a 100% increase in financial crisis, or we saw more people who were elderly, who were not able to access our services and referred via a route that was not an easy access route.
Thank you. No, I think I misunderstood.
Yeah.
The wording of the slide.
Oh, sorry, it was unclear, but I hope that helps. Okay. Thank you.
Thank you. Can we have your question now, Sam, please?
Yeah, thank you. Firstly, I'd just like to say how thankful I am that everyone's pulling in the same direction and there seems to be a collective approach to dealing with children and the desire not to criminalise them. After losing a son to suicide in 2013, after getting himself in trouble with the police for things that were later diagnosed as being connected with his Asperger's, this is really a wonderful thing for all families that's tougher within this area, and it's a credit to everyone involved. But my question is actually to Mark from the CAB. Can you please tell me what mechanisms are in place for gathering feedback from clients and how this feedback is used to improve your service.
Yeah, so all of the Citizens Advice charities are supported through National Association of Citizens Advice, which serve quite a large chunk of our clients. So we get that written feedback sent through to us, positives and negatives. So we can review that on a monthly basis. We also have a requirement of the accreditation standard that we hold, that we have to review that on an annual basis. So we look at where our services are, what demand we're seeing through the issues, and also client feedback. And we feed that into any service design or change that we're putting forward. We're also in the process of setting up client feedback groups, particularly on specific projects. So we would be getting direct feedback, which in some cases is much more useful because we can obviously identify an issue and ask the person a bit more information, whereas the one-way surveying from national can sometimes be a little bit simplistic. So those are the main routes.
Thank you.
Thank you. David, your short question.
Thank you, Chair. Thank you for all the information you've given us this afternoon. There's an awful lot to absorb, and I appreciate that. I just have a quick question with regards to the comment about waiting well, because a number of times one is stopped in the street. As a Breckland council, of course, we've got the answer to everything, haven't we? And they will say, you know, oh, I'm waiting for this surgery and I've been waiting 6 months or 8 months, whatever it is for this surgery. What do I do? And I said, well, go back and talk to your GP. But how does one access that waiting well service in terms of, I just did a quick thing on, I wasn't being rude, on the phone here, and it says that, at one point, it says that the waiting well can only be, only a surgical consultant can refer patients to the waiting well. Is that correct? Oh, sorry.
The Waiting Well project I referred to, it was a one-off after COVID where we had a really long waiting list, where we had so many patients waiting over, like sometimes 2 years, you know, so we actually did a very targeted program. It was the first time we were sharing data. That hasn't continued. Obviously, the waiting lists have started going down, but actually it is interesting what you're mentioning there, because if that's still a need and it comes from the people, it would be something that we can review and see how we can expand it again and into more areas also.
I think that would be appreciated.
Thank you. Next question is Robert.
Thank you, Chairman. I'll try and keep this short. So, straight from Health Scrutiny this morning, we were looking at health performance indicators, and there are 2 areas where Breckland is specifically underperforming. That is in under 18 conceptions, where Breckland is 25th out of 307 district councils. And the second most important, I think, is excess weight in the 4 to 5 year old age bracket. Is that something you will take forward as priorities? Thank you.
Thank you for your question. That is definitely something we are going to be taking forward to ensure that we are combating them targets and challenges in our local communities. I think it's been showcased by some of the partners how we're working together, not only from a mental health perspective, but also that physical health perspective.
Is your microphone on, Josh?
Yeah. Sorry, I'll speak up, sorry. Basically, yes, we are going to be looking forward. We are going to be working on them targets going forward. We're not only going to be focusing upon the mental health agenda, but also around physical health as well, and look into how we can support all of the community to ensure that they have a better physical health as well.
Just wondering if I can add to that as well. So when you talk about teenage pregnancies and some of the obesity issues, all of this is still joined up as well. So you can't look at those as priorities on their own. We know that those are generally a product of households or adverse childhood experiences, which could have been domestic abuse, where children have been party to that. an inability to regulate your emotions, all those sorts of things. If we focus just on those two things, we'll miss the wider picture as to why we've got to that position in the first place. So important that we see those issues, but it's understanding why they've taken place in the first place. And it's probably the same factors that sit alongside all the things that we're here for today.
Thank you. Claire.
Thank you. Yes, I do have a quick question, but I just wanted to say that how pleased I was to hear the update from the DAISY programme and of its growing success over the last few years. I was a number of years ago a trustee, and I know how initially the charity did struggle for funding, so it's good to see how things have evolved and grown with support from Breckland and other partners, and through obviously the hard work of all those involved with the charity. My question's for the communities and housing team. Just to say, how is collaboration among different departments within the council being fostered to ensure effective programme delivery?
Thanks, Claire. Thanks for your question. Yeah, it's really important, and it's something that we continue to do, and working more closely together. The housing and the community teams are working really closely together now, ensuring that we can pick up people upstream and help them before they reach crisis point. So it's a real objective of ours, and it's an ongoing piece of work that we're focusing on. Thank you.
Thank you. We've got, we're now at 3:15. I know that Councillor Land is itching to ask another couple of questions. I think after we finish that, I suggest we have a sort of 5-minute break before we then go on to the next presentation. Well, I would also suggest from the chair that I've got some questions that I'd like to ask, but I'm going to restrain myself entirely for a change, is that we have any appropriate slides that we haven't already had as Commission members or non-members sent into the Commission, which Ruth can send out to you, but also if we have any contact details, and we also either go through Ruth or through Tristan yourselves if we've got any detailed follow-up questions. And I'm sure that Commission members will maybe want to, as I'm sure perhaps at a later date, either have a refresh and go through some areas where we've got a bit more time on one or two areas, because there is a lot to take in today, very valuable, a whole 6 areas, which is a lot to take in. So we could have had the whole lot, not just the whole afternoon, but we've also had the full council this morning. So we could have had probably a whole day and some workshops and breakouts as well. So fascinating so far. So finally, switch over to Terry Land for his quick 2 questions. Terry.
Thank you, Chair. Both for Sonia. First one, hopefully quick. The second one, I'm not so sure. The very first slide of the presentation mentioned antisocial behaviour. As councillors, I suspect it's probably the thing we have people come to us about more than anything, and it is a real issue. I'm really pleased to see that Breckland have invoked a protocol about car meets, and I think that's very welcome. So the question is easy. Have you been allocated any extra resources to deal with that?
No.
And I suspect that might be the case. The second question is going on from the stuff about antisocial behaviour and getting reported. Time after time I hear the police aren't interested. I think you are, but that's the perception. How do we bridge that disconnect?
I think if you have a look, the media has a lot to play and a lot to answer for with regards to how there is a perception against actuals, so that perceived fear or perceived concern. So there is some work to be done there about us. We can't control the media, but what we can do is put out our own good noise that counters some of that, to make people realise that they live in an area that is decent, it's safe, we are connected as a community, and start to try and dispel some of that perhaps drives some of that fear. So that's one way of looking at it. The second, I think, from the point of an officer's perspective, is a lot of the times it's not that they aren't interested or they don't want to make a difference. It's more the helplessness that they feel with regards to actually, how am I going to unpick something that could be quite complicated, or perhaps doesn't sit neatly with the criminal justice system. And that is more where we need to have that partnership approach to some of that. And it doesn't always rest here, it can sit elsewhere. So the more connected we are, the better that is in making sure that the right people are answering those questions and helping to make people feel safe in their own homes and neighbourhoods. Okay.
Turn my microphone on. Thank you very much for everyone's questions today. I'm sure, like many of you, you leave these sessions thinking, wanting to know more. There are questions I thought of later, and we can perhaps collate those when they come in. I'd just like, on behalf of the Commission members and others non-members here today, to thank all the presenters who've come here today. I know we've seen heard about some of your valuable work before, including particularly, the CAB and MIND, and there are lots of areas that I'm sure we'd all like to follow up. So thank you again for coming today. We're now going to take a short break for about 5 minutes. If we can back in about 5 or 6 minutes before we then go on to our next two presentations. Thank you very much. Thank you, ladies and gentlemen, presenters, officers and members. We're just about to, we're going live now, I think. And thank you very much. We now resume the session after a 5-minute break. And the next presentation we have is on the housing strategy. And I'd like to invite Councillor Sarah Suggett, the Deputy Lead Executive Member for Housing and Planning, to present the report. Must apologise if you've been kept waiting a little, as we had a rather packed Inspiring Communities early on, very valuable. We also have another presentation after yours, and we'll try and make sure members keep questions as focused and as brief as possible. And if they have any questions that aren't answered today, that they then follow those up. And if we haven't had any presentations from you, we get those afterwards. So over to you now, Sarah. Thank you.
Thank you, Chairman. Good afternoon, colleagues, and thank you for your time today. I'm very pleased to present to the Commission our new housing strategy, and given what we've just been discussing, it feels very appropriate. We're hearing more and more about the scale and extent that we are facing as a country regarding housing and its challenges. It was announced only last week that local authorities across the country have spent a record £1 billion on temporary accommodation last year. We're not immune to this crisis, and neither are our residents. Our team works hard daily, listening to harrowing accounts of domestic abuse, hearing about terrible conditions that families are living in, are going above and beyond to listen to and help men and women who have reached crisis point and are forced to make impossible decisions. We refer to data, statistics, policies and strategies, but we must not lose sight that what we are really talking about are people and their families. It is imperative that we make sure our team have the tools they need to help and support our residents in the best way possible, making positive impacts and changing their lives. The proposed strategy represents an extensive shift in approach to and seriousness of tackling the housing market in Breckland. It deliberately goes significantly beyond the minimum standard required of us and takes a much broader look at the issues surrounding housing in general. You will have noticed the document provides an overview of the housing challenges prevalent through the district. It links them to the broader national housing crisis and sets out the steps we will address to tackle these locally. Clearly, there are some well-established and complex challenges that we collectively face, which this document is simply not going to fix overnight. However, we have not shied away from these challenges. We have instead formed a longer-term blueprint for change that we aim to embed within the way we work in the future and achieve change as part of an holistic and systematic approach. In doing so, we will be more resilient to change. A good example of this are the recently announced National Planning Policy Framework reforms. And we are certain that this strategy will form a useful part of our wider toolkit to assist us in such circumstances. I have overseen the development of this strategy alongside colleagues, and it is my intention to ensure this oversight is maintained throughout the implementation in the right way so progression can be tracked. I look forward to hearing your questions and suggestions and hope we can ensure this strategy can do all we envisage. Finally, I would like to say a piece of work like this does not just happen overnight. I would like to thank officers from across the Council from multiple teams who have recognised and supported the level of importance we felt this strategy required and have been very patient with me in doing so. I would also like to acknowledge the work that both Gordon and Claire have played in getting this item to where it is today and thank them for their direction, input and support. I will now hand over to Sarah Shipley and Andrew Holdsworth, who will present the item in more detail. Thank you.
Excuse me, thank you, Sarah. So, as Sarah said, the strategy has been produced following extensive engagement with the sector. A collaborative approach to effectively dealing with the housing challenges that we are faced with is essential in order that we can begin to address them. And this strategy provides the ideal platform on which we can do that. Over recent years, in response to the growing housing need and increased levels of homelessness, the Council's taken a more direct and proactive approach to tackling housing issues. For example, the acquisition of temporary accommodation, becoming a registered provider and being more proactive with registered providers and developers to unlock housing issues. This strategy builds on this proactive approach. Through this strategy, the Council's ambition is to ensure that residents have safe, suitable and secure homes, recognising that housing is closely linked to health, but through this strategy we'll play our part in tackling health inequalities. In addition, and crucially, we will work with partners to help increase the supply of housing in areas of priority need. Next slide, please. The strategy is informed by various documents and data. So the Housing and Economic Development Needs Assessment, HEDNA, which was conducted in 2023, which sets out the amount and type of housing required in Breckland per annum over the next 5 years. It's also informed by the Gypsy Traveller and Travelling Show People Assessment, and this document highlights the total accommodation requirement for this community. Also the Stock Condition Survey, as well as data and demand analysis from our housing service, and also the adopted and emerging local plan. Next slide, please. So as I've already said, there's been extensive engagement across the sector. This included registered providers, house builders, from large nationals to small local businesses and voluntary sector organisations. This engagement included one-to-ones, multiple group sessions, and a half-day cross-sector workshop which was hosted here in Elizabeth House. These various sessions were well attended and provided positive feedback into the strategy document, as well as enhancing partnership relationships, providing the platform to take the delivery of the strategy forward. I'll now pass to Andrew, who will just talk through the priorities and delivery of the strategy.
Thank you, Sarah. Thank you, Sarah. This is just kind of briefly summarising the information that's in the document itself. Hopefully you've had time to sort of scan it at least, and we're obviously happy to take any questions, but effectively, as has been sort of articulated, this is the combined view of the sector taking on board the documents of the Director of Travel of the Council, and we've tried to synthesise and focus our effort in a few key areas. So the plan itself, the strategy, sets out 4 explicit priorities around increasing the supply of affordable housing, around improving the quality and sustainability of homes, around making better use of existing homes in the districts, and with a very specific and deliberate focus throughout on residents with the highest needs and the vulnerable. The intention of that being this should really be the kind of guiding principles and the focus for us as a district, not just to deploy our activity, but to encourage partners to do the same. Critically though, and I'm very conscious that the judgment on whether this is a good plan or a useful strategy or not will be on how successful we are on delivering meaningful change. A key element of this that I just wanted to kind of call out is some of the specifics and some of the key bits of activity that we're wanting to progress as a result of this. As Sarah said, we are going well beyond what we have to do in a statutory sense, and there's risks to that. We are talking about activity where we have a limited stake. So a key part of success for this is going to be our ability to continue to work with partners and to get them to deliver on our behalf and for communities' behalf. But we're intending to go beyond that and continue to commit activity and resource from the council, and saying there will be some more things that we will be continuing to invest in and continuing to support ourselves. I've called out a few of those, so sort of linked very thematically and appropriately with the conversations you've been having this morning, just before this session, a focus on prevention. We've also deliberately done this as a joint piece of work between housing operations, but also planning. The timing of the development of the local plan is hopefully really helpful in terms of supporting with new policy and new approaches. We are explicitly, through this plan, committing to grow and continue the work we've done in terms of our own direct investment in housing. So becoming and working as a recognised funding partner of Homes England ourselves, building on our registered provider status and being able to take more direct activity ourselves. We've seen significant potential success through the work we can do to facilitate around things like exception sites, so working very closely with local partners to make sure we can facilitate the right housing happening in the right point. We know there are some acute needs. The document itself calls out nutrient neutrality in particular, so a focus of the action plan and delivery will be what we can do more directly ourselves to support that, to make sure that it isn't a kind of further blocker and a further charge to viability. And whilst the kind of plan sets out more than enough activity for us to kind of be pursuing over the next 4 years, it does also set out some longer term ambitions, such as the council growing its own stockholding stake, but also potential land acquisition, so we can continue to play a much more proactive role should we need to. That is a shape, hopefully, of the kind of rough spirit and priorities set out in the plan. Is the kind of the documents are there for you, and I guess as the chair said, we're obviously happy to take questions here or in more detail offline, given you've had quite a long day. But, yeah, thank you.
Thank you very much, Sarah, and thank you, Andrew. Yeah, I've just got one observation before we go on to questions. Obviously, you've identified the challenges that we have around housing in Breckland, and the most obvious one is the supply of housing in different sectors, whether that's good designed new homes, affordable homes for renting, challenge of social housing, and one of the areas you've identified at 1.7, which is around what's happening around the national policy planning framework. So we appreciate it's a movable feast. And I've noticed you've talked about the focus on practical literacy. So this is the strategy, and I'm guessing that the next areas are going to be filling those things in. One of the things I might suggest as an improvement is you've mentioned a range of stakeholders. That might be something which could be included in a further iteration of the strategy. So you've got a list of those stakeholders. We've obviously got a huge number of them, but in terms of whether that's social providers and possibly one or two, although you put the charts in about the stuff that we've seen before through housing allocations, about the plan, the bandings and the gold, etc., and getting on the register and so forth, is where we've got those areas which are particularly challenging around the district, oversupply, undersupply, HMOs, under-occupied housing. So I've read it. So that's very helpful. But I thought I'd throw this open now to questions from members first. If perhaps keep to one question each, starting off. Any members got any questions on the strategy? We'll take Robert first. Thank you. And then Gordon.
Right. Nutrient neutrality and other infrastructure provision directly reduces the amount of funding available for affordable housing. Is there any way forward? I mean, they have talked about £10,000 a unit for nutrient neutrality. That's about a third of the available budget for affordable housing. I'm not sure that government is aware of this when the legislation was brought in.
Well, without pressing to comment on what the government's aware of, or otherwise, I guess, from our perspective, you are quite right. It's an acute challenge, and the more things that load cost into development, the harder it is, and the more the viability challenges we see. It's why it's been called out as a specific priority for us. So just to kind of talk briefly to what the plan pushes us towards. So you'll probably be aware that we are working in collaboration with other Norfolk authorities around the NEC and the Nutrient Mitigation Fund. That is intended to kickstart a market, so there's a market there to support. As outside of that, we've been working with funders specifically to help find access to funds to help effectively, where there are affordable schemes, to help support them, particularly on brownfield sites, in getting access to additional resource to unlock homes. That's very reliant on there being credits available, but it's a key part of it. We are also exploring the use of council-owned assets and council land, so we can have a more direct stake in the kind of credit generation market, and obviously that would enable us potentially to deploy them to kind of strategic needs as well as just the open market. So it is an issue, and it is something we acknowledge we're going to have to be more proactive in supporting.
Yeah, doesn't undermine what the policy says, I don't think, but it is a major issue that has to be dealt with.
Thank you. Gordon.
Thank you. Well, nutrient neutrality, I think they are stumbling along towards getting some sort of satisfaction on this problem, aren't they? Or from what I hear from people in my ward. I think market housing will probably take care of itself, especially if what the Deputy Prime Minister tells us her target's going to be will actually come through to here. And I wanted to come in really because I'm more interested in the rural areas, as you know, with are dealing with exception sites. And I know you mentioned that, and I'm pleased you did. And I think exception sites are dreadfully important. I think we should look at urban exception sites as well as rural. I think we can make a good case for it. I think we certainly ought to look for faster planning on exception sites. I think there are all sorts of problems which come up from the planning department that we as a council, I'm sure, could satisfy. And if you can't think of them, I'm happy to sit and have a talk with you. So I would like to see us getting more exception sites, rural and urban, because they are sites that deal with our local housing need. And you've told us in the report, I think there's almost 1,700 people on waiting lists, and 700 of those are either emergency or gold. Well, I would have thought the ones who are called emergency ought to be dealt with today, and the ones who are in gold ought to be dealt with next week. And with 700 of them, that's not going to happen. And I mean, let's be realistic, but that's what we must be aiming for, to get those people off the list and into some sort of homes. I think we should also be looking at specialist housing, containers, housing for communal areas for old people and so on, that are sponsored by and supported by this council. And well done on the stockholding. I mean, the stockholding is something that I think we really should increase. And I think what we've done in recent years has been excellent. So well done on that. So it's not all positive, but I really do think we are dropping the ball a bit with exception sites. And that's where we should be looking, because they will deal specifically with the people who are on the list. Thank you. Was that a question? Yes, please speed up exception sites.
Thank you very much, Gordon. I could have predicted that question from yourself, knowing your knowledge in the area. Any other questions from members on the strategy? William.
If I could just follow that really. On the exception sites, I'm pretty sure you can only do that with housing associations. And years ago, I put forward an idea through the political group, through the council, and it was many years ago, that if we expanded the idea of exception sites and went out to farmers who are always struggling to make a buck out of a piece of land, and said, actually, we'll allow a farmer under a 100-year lease to build 5 dwellings on the edge of a village, but we'll lend them back to the council or whoever. Most farmers I spoke to said, yeah, that'd be a great idea, and actually we'd support it. We've always been told as councillors you can't do it, because it would be a private house, it wouldn't be social, the farm would still own the properties in perpetuity, etc., etc. Why can we not revisit that type of idea so that we can actually build many, many more houses? Farms have access to capital, and they're looking to earn some revenue. It's an easy way for a farm to earn some revenue, but we've always blocked the idea because we say no, it has to be through a social provider. Why can't we be the social provider that actually takes them on from the landowner, builds out these on the edge of villages, and actually starts to address this huge number that we've always struggled with because our social providers won't build. You know, Lopham, I know we've tried to build 5 in the more recent times. We've always struggled. They've said you can't find land, etc., etc. I have got a landowner that will build 5, but they'll be private. Now he's going to submit his application very soon to Breckland, so it's no secret I'm divulging here. I don't know that it will get through the system. I mean, you know, he knows it's I won't say who it is, but the developer that's doing it says, I don't think we'll get it through. He'll take a punt on it, but he doesn't think he'll get it through. Because again, it won't be, the legalities of putting the system together to enable them to be rental properties but owned by him is apparently very difficult. Well, in my world, let's overcome the difficulty and make it happen. Find a way through the council to lead on that. There was no question.
Thank you. I know Gordon wants a...
Directly on that point that William raised.
Okay.
It was directly on the point that William raised. I have a farmer in my ward who actually had exactly that problem. He wanted to build 5 houses. He wanted 3 for rent, and 2 would be what we'd call market houses. There was a twist to it, but that doesn't matter. But the point is, he set himself up as a small
getting, oh, it's collapsed, I'm sorry. It's collapsed.
It's been a long day.
Sorry, the microphone failed. He set himself up as a registered social landlord, managed to build the houses and rented out successfully. Now, I think he has shown us that there's a way through. This council approved it. I don't know how they managed it, but they did. So you can refer back to it. I'll let you have the planning application if you want it later on.
Thank you, Gordon.
Thank you. Just, I know there weren't specific questions in there, but just in relation to that point, I think from where we are at the moment, there's a perfect storm. We've had many years where we haven't been building enough of the right type of houses, be it in the right places or not. We've just not been building enough of the right type of houses. You couple that with all of the things that we've already heard today about why people are getting themselves into the situations where they are. They're not for their own fault. They're not for their own doing. But the solutions aren't necessarily out there, and if we can't help people find those solutions, we're doing something quite wrong. It was really heartwarming to see at the stakeholder sessions that we had a real mixed bag of people attending. There was the voluntary group, we did have developers, there were landowners, and they've all got their own challenges and they're all in a different space now, and it seems a really right and appropriate time to be able to sit down and have the conversations. And if some of the solutions doesn't sit directly with us, they will be sitting within the group of people that we're able to get and bring together. So I think there is something now where starting to think outside the box to address some of these issues, we can overcome some of those challenges. So, yeah.
Thank you, Sarah. The Commission, I know in the recommendation, before we move on a bit further, we're asked to review the strategy and support for housing in Breckland and feeds in to any comments, suggestions to help further refine the approach. After today, what's the next steps and timescales in terms of the strategy that going to Cabinet, onto the website, updated as necessary? If you can perhaps expand a bit more on that.
Yeah, so it is coming to the next Cabinet meeting, which I don't remember what the date is, and I don't remember what the cut-off point is. It's been a really long day, but Andrew is quickly beavering away to have a look at what that is. But yes, so it will be coming to the next Cabinet meeting, and I would just urge if anybody does have any comments that they would like to make, or questions that they would like to ask, I think afterwards, just as soon as possible, would be helpful.
Thank you. Robert.
Perhaps in the conclusion section we could add a short paragraph that Breckland will continue to seek innovative solutions to the provision of social housing.
Happy to do that, yeah.
Thank you. Any more questions from members, contributions? David.
Thank you, Chair. Just a quickie, in terms of making better use of existing homes, which is priority 3 in the programme, are we working together with other district councils in Norfolk in terms of the DFG grant situation, and maintaining or getting as much funding as we possibly can? Because obviously we've got a large number of homes that need the DFG grants, which we're unable to give at the moment because there's not just enough money. And I'm interested to see whether we can work in collaboration with other districts in Norfolk to central government to get that pot of money, because it obviously will enable us to house more people in some existing properties that are out there. Sorry.
That's okay. Yeah, no, so thank you. So the team do a really good job with, like you've alluded to, not enough funds to go around the amount of people what are there. And that isn't something, again, which is unique to us. And I think that point within the strategy, that's a small part around where the DFG provision still isn't going to be giving us enough homes. It's going to be adapting some homes so that people can live in a better environment. But on the whole, it's more homes which are needed and what's in there. But the team do as much as what they can with the limited pot with regards to DFGs in the best way possible.
Thank you, Sarah. Thank you, David. And Peter.
Yeah, I haven't got a question, Chairman. I will tell you that. I'm happy that we have a housing strategy priority, because without it, our housing team are just going to be out on their knees, aren't they? Because they haven't got the houses. They're the ones that's bearing the brunt at the front of the public perception there, with no houses, and they can't magic them out of the air. So there is a strategy there. It can be done. In one of my villages in my ward, I know there's some land there owned by Flagship. They've got no intention of building on it. And I tried to offer it to Breckland, but obviously we can't do that, because it's got to be our own land. So whether they can buy that from them, I don't know. But so I'll push that further on, I think. But we need it to help out our housing team, because they're at the brunt of everything.
Thank you, Peter. Unless there are any more comments, I think Gordon's got his hand up again. He's getting his teeth into this now. Go on, Gordon.
Sorry, Chairman, but other people are not putting their hands up, so I thought I would. It was just your priority 4. I mean, you may not know this, Sarah, but there was a rather interesting planning application at the last planning meeting where a vulnerable person wanted to build a home for themselves. And our planning policy actually prevented officers approving that. It came through to the committee, and the committee actually decided that our policy was just about wide enough to allow them to do it. And there are people who do need a special type of resident, for whatever reason. And I think we should make sure within our planning, our local plan that is now going through, that we make provisions so they can do that. So officers can clearly give approval on some types of application that they can't now. I know that's technical, and nobody who's listening to this online is interested in it, but I think that's something that you probably ought to look into.
Thank you, Gordon. Sarah.
Just to come back on that, it does seem a very crude way to go through the theatre of what I know the case that you were talking about, but to go through the theatre of what had to be gone through so somebody can look to build a home for their specific needs does seem really unfortunate. But this particular strategy, it's not something which is intended to be a document which gets put up on the shelf and we dust it every few years. This is definitely something which we're looking to work with other documents that we have across the council, the local plan being one of them, so that they can be used to help make those decisions better, because nobody wants to be able to sit at planning committee. I appreciate that that's what planning committee is there for some of those applications, but nobody wants to have to sit there like we had to last week at planning committee to hear what a family was going through, for us to be able to know that it was the right thing to do to help. So yeah, this isn't something which we look and we think we'll use in perfect isolation. It will be part of a suite of documents that hopefully planning officers will be able to use so that we can try and avoid those situations.
Thank you, Sarah. Can I suggest that members, if they've obviously got any further views, feed them perhaps into Councillor Suggett, but also, as Sarah's mentioned, the forthcoming cabinet, that any members also attend that, and if they have any further thoughts on it. The Commission is asked to, the purpose of today in the strategy, to seek the adoption of a new housing strategy for Breckland, and the recommendation in number 1, that the OSC reviews the proposed housing strategy and support for housing in Breckland and feeds in any comments and suggestions to help further refine the approach. And I'm pleased to see this will be ad hoc and it will be revised, as I'm sure the landscape nationally and locally will change quite dramatically in the next few months. And I'll just ask the Commission if they're happy to endorse that recommendation. If I could perhaps see a show of hands from voting members. Thank you very much. That's carried. Thank you very much, Sarah, and Andrew. Thank you. So. Thank you, members. We've now reached item 10 on the agenda, which is the website refresh. Obviously, we've got the website already, and this is to receive a presentation on the website refresh, why it's changing, what the approach has been, the intended benefits, possibly looking at test format, and invite the West team to give a presentation. And as with my previous comments, I'm sure members will want to look at this themselves and interact with the website themselves to make sure that they're happy and taking any feedback they get from residents of their own wards. So over to you, Alison.
Thank you, Chairman. Okay, hello everybody again. Okay, so today we're going to talk about the new website design. This has been in the making for several months now, and funny old thing, everybody has a different opinion about what it should look like. However, we have looked at it again and again, and I'm pleased to share with you the new website design today as we see it. We're still consulting on the way it looks and everything, so it's not finished, ready for review. They will show there. And it's our digital shopfront, which basically is over 100,000 views every year. We need to showcase our key services and make sure that everyone can access the information they need as quickly and as easily as possible. The new homepage design prioritises functionality, accessibility, and a seamless experience for mobile users, reflecting the needs and preference of all the people that engage with us. I've had a look and it really is a lot more simple now, which is good. Accessibility has been a great focus of our redesign. The site will comply with the latest accessibility standards, making it easier for all community members, including those with disabilities, to use our site. With over 3,000 pages of content, this redesign is just the first step towards making it easier for residents, businesses and partners to engage with us. I'd just like to say that the old website did not go onto phones very well. This one's been designed so that people can use it on phones as well, so it's a definite step forward. This is Rosie, who is our digital project manager, who's going to talk you through. Over to you, Rosie.
Lovely, thank you. So I'm going to briefly explain why the current website needs a redesign. I'm going to let you know a little bit about the key objectives and the design principles that we followed. There'll then be a short demonstration of the new design from Neil Wood, who's the digital team leader, and we'll find out what progress has been made to date on the project so far. Next slide, please, Ruth. So the Breckland Council website was in need of a refresh for several reasons. The legacy design no longer matched current standards and resident expectations, having last been refreshed around 7 or 8 years ago. With 68% of our visitors now accessing the site via mobile devices compared to just 28% on a desktop, it's essential our website can be viewed effectively on mobile devices. Updating the website will enable us to create a more intuitive and user-friendly interface, which will enhance satisfaction, improve accessibility, and help residents and businesses find the information they need more easily. In that time as well, our brand guidelines have been updated, and we want to make sure our website aligns with those to ensure consistency across our communication channels. And then finally on there, customer feedback received on our website supports the change towards a more task-orientated site. Next slide, please. So we set out 6 key objectives for the project. We wanted to enhance the user experience so residents, businesses and other visitors can easily access popular services like waste, planning and housing and complete tasks efficiently. We needed to adopt that mobile-first design approach to ensure the website was responsive and provides a seamless user experience across all devices. The new homepage design incorporates contemporary design principles and aligns with those branding guidelines to improve the visual appeal. The website will also comply with the WCAG 2.2 AA accessibility standards. That will ensure equal access to information and services on our website for all community members, including those with disabilities. And with over 107,000 views from around 48,000 people every year, the homepage will also serve as a platform for highlighting our revenue generating services. And then finally on there, we also want to reduce the manual maintenance by moving to a core design theme. Currently, our site is very customised and has a very bespoke kind of design. That means that when we get updates from our platform provider, they don't always work properly, and it means that our digital team has to manually fix issues. Next one, please, Ruth. So there were some key design principles that we wanted to adhere to. Firstly, consistency is really important for ease of use and familiarity when people interact with our homepage and then navigate through to our content pages. So an example of that would be items like link colours to help users identify them across the site. Functionality over aesthetics was a guiding principle. You can have a fantastic looking website, but it doesn't necessarily meet the needs of the community. So while we explored several potential design ideas for the homepage, so more background imagery, more curved or circular designs, you'll see in a moment, we knew this wouldn't work as well for our mobile users. So instead, we took inspiration from popular modern sites like TripAdvisor, eBay, which all have a horizontal linear grid-like structure that not only displays well on mobiles, it aligns with our brand guidelines and also our website platform capabilities. We also made sure that we kept the design simple, clean and straightforward. It emphasises key user tasks and search functionality towards the top of the homepage, whilst leaving space further down the page to promote news, events and place-related items. As we've said earlier as well, ensuring accessibility for our customers is crucial. So what we've done is we've focused on sufficient colour contrast for improved readability. We've retained the accessibility toolbar in a really prominent position on the page, and it's present on every page. What that means is that our residents can use this feature to customise the content in ways that work best for them. So that could be increasing the font size, it could be different text or background colour for readability, or it could be the content being read out to them using that toolbar. We've also made sure that we've prioritised user tasks in our user-centred design by introducing popular searches that can be changed seasonally or in line with customer demand. And we've made it quicker to get to key information from our homepage. And finally on there, we've been gathering feedback throughout the design process. We'll continue to gather feedback as well after the release so that we can iteratively improve the homepage design and that underlying site navigation. Next slide, please, Ruth. So this is where I'm going to hand over to Neil, who's going to hopefully be able to share and play a short demonstration video that will show you that homepage design from kind of top to bottom. So Neil, if you can share now.
Hello, and welcome to our newly enhanced homepage. We've made some key improvements designed to better serve our residents, tourists and businesses. First, you'll notice the sticky header, ensuring our logo and search function are always within reach. This means quick, easy access to the information users need, whether they're a resident looking for a service or a tourist planning their visit. We've also introduced a top hits feature for popular searches, reducing the number of clicks to access our most used services. This streamlines the process for everyone, making it even easier to find what they are looking for. While the apply, pay and report sections will remain, we're currently enhancing these landing pages to simplify their navigation and improve the overall user experience, ensuring that essential tasks can be completed quickly and efficiently. Our interactive services widget, Goss's Peaky Slider, now allow us to highlight revenue generating options first. By prioritising these services, we are supporting our community's sustainability while making it easier for businesses and residents to connect with what they need most. We've combined news, events and initiatives into a single, cohesive section. This will offer a unified view of what's happening in Breckland, helping users stay informed and engaged with their community. The new Discover Breckland section invites tourists to explore our unique offerings and help residents and businesses stay connected with local opportunities. It's a gateway to everything that makes our region special. We've also enabled page-specific feedback, giving users a voice in shaping their experience. This latest iteration of our homepage will be live soon, but there's always scope for future adjustments based on user feedback. Customer input will guide us into making ongoing improvements that truly meet the needs of our users. And finally, we've refreshed our footer for consistency across the site. This ensures that essential links and information are always easy to find, no matter where you are on the site. Our new website has been designed with responsiveness in mind, ensuring it works seamlessly across all devices, including iPhones, iPads, and other mobile devices. Whether users are accessing the site from a desktop or on the go, they'll enjoy a consistent and user-friendly experience, making it easier than ever to stay connected with the services and the information they need. As we move forward, our next step will be to focus on the landing pages that underpin the homepage. We are committed to ensuring that the entire site provides a seamless and engaging experience for all users. These enhancements are all about creating a user-centric, efficient, and inviting digital experience for everyone, residents, tourists, and businesses alike.
Brilliant. Thank you, Ruth. So we've recently conducted our first face-to-face testing sessions with residents. Sorry. Brilliant. Didn't get any feedback on the video, so that was good. So we'll move on. We've recently conducted our first face-to-face testing sessions with residents and also invited some resident staff members to test the site. We're now about to set up some remote testing via Teams, so we can include residents who can't as easily visit the office, so we get a really diverse range of feedback. Initially, we sought volunteers from community groups within a district, like the U3A, some men's shares groups, some disability access groups. And just this week, ads have gone out on social media asking for more volunteers across the district. And we're also aiming to engage with more community groups in the future, like the Youth Advisory Board and other organisations. Although we've only done a little bit of user testing so far, it's been really positive and given us some really valuable feedback on several different areas. Things like validating our task-orientated homepage, suggesting some more intuitive service area names, so swapping out words like enforcement for complaints to make it easier for people to search and find the information that they need. And other areas like increasing the size of the search magnifying glass icon at the top of the page for people with visual impairments, or maybe even limited mouse control. By incorporating that feedback into the design, we're striving to create a website that better meets the needs of our residents. Next slide, please, Ruth. So just to give you a little update on the progress that we've made today towards the release of the new design. So we completed a spring clean of the existing content, making sure it was still relevant and checking for accuracy. And that's over 3,000 pages that we've looked at. We've commissioned our existing website supplier with a clear brief. We received 2 initial designs that we then gathered feedback on from a range of internal stakeholders, including cabinet members and staff, which all helped to steer the design process. And that led to the single design that you've just seen today. As well as the user testing, we've embarked on testing the new design across various browsers and devices to ensure that there'll be minimal issues when we switch over to that new design. And following the completion of the testing, we'll be finalising the new design and plan to release that in December. So please know that's the end of the presentation. Thank you very much for your time, and me and Neil are both here to answer any of your questions.
Thank you. Just a quick, simple question for me to start off with. I said when we look back at different websites across different things that we all use, and we look at something that was, 2 years ago, etc., and we see how much it's all changed. When will this be going sort of live?
So this particular iteration of it will be December, but the intention is with gathering that user feedback, rather than this being a one-time thing that we release and that's it, we intend to then review that over time. We've got elements on there that can change and be flexible with the demands and the needs of our residents, businesses, and anyone else that's coming to visit it. So December at the minute.
Okay, just one quick question before I hand over to members. Sort of left field question is the, in terms of the website there, is that secure in terms of any, you know where I'm going, in terms of hacking and things and people copying and pasting and things like that?
Yeah, so the design there will still be on the same platform that we use at the minute. So we know that that's secure, that's been verified, they have all the various kind of credentials to show that. So then this is just applying a new design theme on our existing site. So yeah, we're confident that that's still absolutely secure.
Just thinking of the prevalence of scams and stuff around the county at the moment. Yeah. Thank you. Open to members. First of all, Peter.
Thank you, Chairman. Thank you, Rosie. You said about volunteers. Is the only way the access to let you know is on the social media page? Did you say Breckland, or is there another one? Because I'm at the Youth Advisory Board meeting next week, and I think it's very important those young people have an input. And is there a way they can engage with you as well and say, well, actually, this would work better because their young brain is working different to mine, type of thing?
Yeah, they work even different to mine as well. So yes, so what we've put on social media is an expression of interest form. So we do want to capture some details from the people that are going to be doing the testing for us. That's that we do get a diverse range of testers, a diverse range from different demographics. So that's one way that they can do it. If not, be more than happy if you want to share my details, or we can get in touch, because yeah, we can arrange something a bit more bespoke for them. If we can get some of them in, and maybe even for a workshop, then that would be fantastic, because we really do want to get a range of views on that, and that will be ongoing as well. That won't hopefully just be a one-time thing. We can continue that a bit more regularly as we introduce other changes or features to the website in the future as well.
Thank you, Rosie. I appreciate the invite for the Youth Advisory Board. I'll just mention as well, I thought I saw one photograph on there which needs updating, the lottery one. I don't think those accounts exist anymore.
That's absolutely fine. They're currently holding images, so one of our tasks that Neil's got is to source some appropriate ones. So yeah, we'll get some that are accurate. Yeah, fantastic. Yeah, we'll take that.
Thank you. Robert.
Thank you, Chairman. I presume the phrase page review means you're going to delete some. Could we be given a list of the ones you're deleting, because the more obscure information hunters among us might disagree?
So the content review has been completed. There were pages that were archived or deleted, but they were, like you said, it was content that was no longer either accurate or relevant for the site. It was a bit of a spring clean, in terms of that information. So there shouldn't be anything that would be important, would be essential, would be needed to be there for legislation reasons. I believe we have got a list of all of that. So if you were interested, that is something that we could provide, I'm sure. But there will be further work on the content as well. So that was initially for that accuracy side of it. We know there's a lot more work to be done on our content to make it as user-friendly as possible, to make it more task-orientated as well. But there shouldn't be anything that was deleted that isn't, necessary.
Yeah, I think there's some quite ancient stuff that constitutes part of the planning evidence base, and that was mainly to what I was referring.
I was just going to say on that, in terms of the deletion as well, it was completed by our web editors, which are the subject matter experts within each service area that are responsible for the web page content. So rather than me and Neil and the digital team, we've got our skills in one area. We don't necessarily know the ins and outs of all the kind of planning information, the data there. It was those experts that were responsible for that content review. So I would hope that they would then ensure that all of the right information was there, and it was only old or out-of-date content that was deleted or updated on the site.
Thank you. Gordon.
Well, I'll emphasise and underline what my colleague said. There is no piece of information that's irrelevant. It's all relevant to someone, and I know some areas of County Council have done away with certain bits of information which some people I know are very, very interested in and wish they could get back to it, so I'd be very cautious. The question I wanted to ask is, are you improving the way that people can contact the council on a physical, face-to-face type situation, or it could be email to email type situation? It's very difficult sometimes to know who to contact in the council if you come through the website by name, and it's sometimes difficult to even contact departments. You know, it seems as though lots of people are trying to hide behind the website rather than be pushed up front. I know lots of companies do that. Other companies make it very, very easy to contact. So do you have a space on all of your major pages, your key pages, where people can make a direct contact with an officer, or indeed perhaps a member sometimes, and a personal contact on a personal issue, be it by telephone? Telephone numbers seem to be disappearing, but some of us old people still use them. And or just a personal contact by being able to fill in a contact form. I don't know what you call them.
Yeah. So there's a couple of bits there. So we have steered a bit away, I would agree, from direct contacts on the website for email addresses. There are still some there where it's appropriate, but what we've tended to do is use those contact forms that you've talked about there. So there are, for most services, there's a contact form, there's specific forms for specific inquiries, and there's generally a general inquiry form. And the reason we've moved towards those is because they then capture exactly the information that that service needs to be able to answer that inquiry as efficiently and effectively as possible. So we have those in place on the website. I get what you're saying as well, that there may be just things where you want to speak to someone directly. But for that digital platform, that is what we've kind of moved towards. What we also have in addition to that is we've got the contact information on there. And we'll still be retaining the chatbot as well. So that will remain on the website, which gives people an opportunity to either get the answers that they need directly through the bot, or it still retains and gives you the option to speak to someone via live chat as well, so that you can speak to, within office hours, a person on that contact channel as well. I don't know if that completely answers it, but whether Ralph wants to add anything.
And me as Mr. Joe Public sitting there with a major problem, in my opinion, how do I know who to contact?
That is a very good question. Yeah, it is. And this is one of the things that we want to do around, for the next stage of this website redesign through the user testing. So when you go onto our website now and you may search for a particular query that you have or a particular service, the terminology you use or what you write in there may not be what we use as a council. So one of the things that we'll be doing as part of that user research is looking at that terminology and that site navigation. We'll also be looking to improve that search functionality. So if you did come to our website with your particular problem, when you search for that the results that you get are appropriate and accurate, and that they can get you where you need and to the information that you need as efficiently as possible. We appreciate there is some work still to be done on that. That example I gave there, for example, with enforcement versus complaint, and there's lots of other terminology around that. So yeah, they're the next steps of the project.
Thank you, Claire, and then Robin. Thank you.
On a go. Yes, so does this mean that, for instance, if you're searching planning applications and related information, that it's going to be quicker to get to that and more? Because at the minute, you have to go through so many clicks and you end up with all these pages open and going from one to another, and it's just, it's not very, not very good.
Yeah, that is definitely one of the things we want to do. There's a certain element of clicks you're going to have, just because of the, to get to that information and the way you have to have it structured with sort of these landing pages that then drill down into the information. But as you hopefully saw in the demo, one of the things that we'll be doing is that popular search. So that can then be dynamically changed One of the things we will have on there is planning, so it will reduce those number of searches. It will literally be there. If you went to the homepage, you could go to it. And related to the answer previously as well, if we get the search working correctly, it's not just about coming to the homepage and then navigating to the content. It's you going into, you know, any of your browsers and searching, and it goes to the right search result for you based on what you've entered and gets you where you need to go as well.
Thank you. Robin.
Thank you, Chairman. Is this all being done in-house, question one? And question two, what sort of traffic do we actually get to the website, out of interest? Thank you.
Some of the work's being done in-house. So we initially worked with our platform provider, GOS, to create some designs for us. Using their expertise, we gave them a design brief, we gave them the branding guidelines. They came up with some initial designs, which we've then, through various iterations, we've amended and changed. We did engage a company as well to support with this. So they were a design and user experience experts that came in, reviewed the site and made sure that we were then sticking to those clear objectives that we set out at the beginning. They made a series of recommendations and improvements that's then led to the iteration that you've seen today. And just remind me, what was the second question again, sorry? Traffic to the site. I do have the numbers. So in the past year, so this is August 23 to June 24, total users that accessed the site was 165,000, and the total views to our site was 866,728. So it's high levels of traffic that we get to the site. People use a mixture of, as I said before, mobile users is 68%. That's around 114,000 of those users, and the 28% desktop users was around 47,000 users. So coming back to the point we said about mobile, we want to optimise it for mobile, but we also want it to work well for those desktop users.
Thank you very much. Are there any more questions before we possibly conclude this particular session? If not, can't see any hands up. I'd like to thank Councillor Webb and the Webb team for coming along today, and thanks for your patience in waiting. And I'm sure you'll send us, all members of the council, a reminder, you know, when the website is live, so we can all go in and you know, look at it for ourselves, and obviously familiarise ourselves, and then also you know, talk to residents. And I particularly appreciate Gordon's point about you know, a point of contact, because I know sometimes us councillors struggle, so I don't know about residents, but thank you very much and keep up the good work. Thank you. Thank you. Thanks for coming along.
Can I just say something? I know you thanked him, but I want to thank Rosie especially, because she's been through hell the last few weeks. I know she has. And she's done an amazing job to get it to where we are today. So thank you.
Yeah, thank you. Thank you, members. Next item is number 11, outside body feedback, to receive an update from anyone on outside bodies. And I think possibly that might be Robert and potentially Gordon as well. Thank you.
Thank you, Chairman. Well, fresh from this morning at Health Scrutiny, we looked at two items. The first was NHS dentistry. There is now a 5-year long-term plan to improve that in Norfolk. For instance, last year there were 3,780 new patients signed up. This year, since April, it's 20,653. There is going to be a focus on child provision in the first instance. And just to say that school dental nurses are part of the public health hat, not part of the primary care hat, but they are talking to each other, which is a novel innovation. And they have upped the payment to dental practitioners from £25 to £30 per dentistry unit, and they have engaged 23 providers on a voluntary basis to improve those systems. I know that other members of this commission have had concerns about dentistry, and it's still that's only 65% of the county that has signed up on this voluntary basis, but it is a big step forward. And we then looked at statistics on women's health, and that's a much wider piece of work, which I think the best thing to do on that is distribute the agenda to the members of the commission. Thank you.
Thank you very much, Robert. Any further outside body feedbacks? David and Peter?
Just a quickie, very relevant to what we just heard, actually. I'm pleased to say that the Hammonds Educational Charity, which, as most of you know, I chair, has now a new website, which is far more proactive and available. And as a result of that, it only came online last week, and we already have 11 applications, because the application form can now be filled out online. In the past, people had to print it out, write on it, and mail it. Very archaic, I know. But anyway, now we have a new website. And the other good news is that after today's session, I was able to strike a deal, if that's the right word to use, with Mark from the CAB. And the CAB will be working in close cooperation with the Hammonds Trust as far as Breckland is concerned. Of course, he's the CEO for Norfolk, but he's very, very keen on working with us to increase our presence within Breckland through the CAB, because most of the CAB issues that are coming through his door are debt related, with people who don't have any money, maybe to get a laptop or something else for their child at school, which is very important these days. So that, I think, is going to hopefully increase the footfall to the Hammonds charity as well. So I will be sending something out to all members with an update on the Hammonds Trust, so that if you are aware of anybody in your ward that is struggling financially and needs some help with somebody within their family under the age of 21, then we may be able to help. Thank you.
Thank you, David. I think, Peter, I think you had your hand up.
Yeah, thank you, Chairman. Yeah, the Minds Report obviously kept their summer activities going for young people and families, and taking them out on activities and excursions, and been very active on that. They're still working on the inclusion equipment in new playgrounds, and we've had a good response from town and parish council so far. And I'd like personally to thank Breckland community officers who have been taking this on board, and when they've been out advising with planning and different things about playgrounds, they have made sure they know about they'd like to see inclusion equipment and surfaces. And with the QEH, where I'm representing Breckland, I've been working with execs and board members down there with Health Watch Norfolk to create a youth council, so they can have a say on their health going forward, and in particular in Kings Lynn, the new hospital. And if anybody's interested, who might be watching, or councillors, or when the minutes are read of this, if they contact Health Watch or myself, I can then put them forward, or get them to scan the QI code to show their interest in joining the council, which I think is very important. Thank you.
Thank you everyone for that very useful feedback. Next time we have on our agenda is scrutiny call-ins. I haven't had any call-ins received to date. Next item is our councillor call for action. I just ask members if they have received any referral or calls for action from the Commission. I'm not aware of any, but if there are any, please speak up. Thank you. We've got a copy of the work programme. Agenda item 14 is attached as usual. If we want to agree any additions, deletions or amendments as appropriate, please let us know now or in the future. Ideally at this meeting, but it doesn't have to be wait until the next meeting. So if you've got suggestions for future work programmes that aren't on there, you know, please let myself, you know, through Ruth know. And I think Robert's got his hand up. Thank you, Robert.
I would say so sometime after Christmas, I would suggest we perhaps need a report on the transfer back into Breckland of the planning and any lessons to be learned and any opportunities to be gained. But give them 6 months to settle in first, I think.
Thank you for that. As I said, don't hesitate to provide us with any suggestions, you know, in between meetings. Ideally at the Commission meetings, but in between. So thank you very much for that. Our next meeting is, you'll be pleased to be held, is on the 24th of October, this time on a Thursday at 10 o'clock in the morning here in the Anglia Room, which will be on a non-council day, hopefully, and I think we can continue this practice on a Thursday unless they're very exceptional circumstances as fitting with the boundary permission and so forth. So it just remains me to thank members and officers for their patience in a long day, those of you who've been here all day, and your contributions. And we're now in the stream. Thank you very much.